Assalamu alaikum everyone, my name is Rajab Basha and this is my crash course on BHS. Now my approach to the crash course was that I made it as comprehensive as can be because you can never really predict where the questions come from for BHS. However, for the sake of time, I highlighted the high yield points in red, and these are points you should especially focus on. And yep, let's just start. So first of all, Bismillah ar-Rahman ar-Rahim, Allahumma alimna ma yanfa'una. I just want to ask you guys to be open to studying BHS. I know that for a lot of students, BHS is a challenging subject, and just remove the negative mindset for a second and try to approach this positively with an open heart, and it's going to make learning easier for you. So, to not say more, let's carry on. These are the topics I will cover. They're basically your pre-midterm material. And now let's talk about the first lecture, which is really simple. It's just some things you have to memorize. Introduction to infant development. Now, development can be physical or mental, as we're going to see. So, very early on, after conception, we have these embryonic periods, fetal periods. So, the germinal period, then the embryonic period, then the fetal period. The germinal period, from the name germination, comes immediately after fertilization. And this is highlighted in red. So is this, so I expect you to focus on these more. Focus on everything, however, give special attention to the things in red. So this period is immediately after fertilization. And this is basically your embryology from first year, so zygote, morial, blastocyst, the placenta, which develops 5 to 6 days after fertilization. And then we have the embryonic period, which is from the middle of the 2nd week to the end of the 8th week. And this is when you have the major organs in circulation, so really important things start developing in the embryonic period. Then we have the fetal period, which is from 9th week until labor, and this is important. And in the fetal period, the baby basically grows a lot, going from 2.5 centimeters at 8 weeks to 13 to 15 centimeters at 16 weeks. And what matters to us most when studying BHS is that the fetal period is the origin of motor, sensory, and learning behaviors. So obviously BHS talks about behavior, so this period is important to us. And going forward, I'm going to give you mnemonics to memorize the numbers, which is one of the most challenging parts about BHS. So just bear with me for a second. Now, here are some principles guiding development. Development happens in the cephalocaudal direction. What does this mean? Cephalic and caudal. So things start developing from the head down, from the cephalic into the caudal. So just keep this in mind. Then things will develop from basic structures to more specialized structures. So obviously, not by the 2nd day of development you just have a full-grown brain. No, it takes any steps going from basic to more specialized. And organs will develop in order of importance. So important things like the brain will develop first, followed by more unimportant, relatively speaking, things. Now, the brain, because most of our discussion is about the brain and learning, the brain will begin development at 18 days after fertilization. So to speak, this is in the 1st month after fertilization. And the size of the brain actually decreases as the fetus gets older. Now I want to pause here quickly. What happens is that as the brain develops, the neurons will keep proliferating and proliferating and proliferating, and we have a bunch of neurons. Now obviously this is going to leave a baby with a very large head, and a baby with a large head is not going to be able to pass through the birth canal. So what has to happen is that the brain shrinks in size, and the body grows relative to the brain. So the size of the brain is going to decrease as the fetus gets older, going from 25% of body mass in the 9th week to 10% in the newborn to 2% in adults like me and you. And you can recall from first year that the neural plate develops into the neural tube around week 4, and the midbrain will develop around week 4. And we know this structure. You're doing neuro, so you should know the structure. This is basically the brain, and you can see its parts. So the hindbrain, which is the first to develop because it's more basic, which I believe is the medulla, if I haven't forgotten. Then the midbrain, and then finally the forebrain, which develops into the diencephalon and the telencephalon. The telencephalon is what we care about in BHS because it has the cerebral. It becomes the cerebral cortices, which has the gray matter, and this is where thinking and personality and behavior all happen. Now moving on. All your neurons will have been formed by the end of the 2nd trimester. Now just to orient you guys, and this is not in your slides, however the trimester weeks, the 1st trimester is from 0 to 12 weeks. The 2nd is from 12 to 26. The third is from 26 to 40. So all your neurons will have been formed by the end of the second trimester, and then your brain will start shrinking because these are also non-functional neurons, and as we said, we need the brain to be smaller so that the baby's head can pass through the birth canal. So we have the rapid cell production stage, which is from 10 to 26 weeks. As we said, this is around the second trimester. Then we will have pruning or apoptosis. Pruning means cleaning in English. As we said, proliferation, then pruning or cleaning. This is the order that the doctor also emphasizes, is that the cells or the neurons or the brain starts with proliferation. This is important. The first step is proliferation. Then migration of neurons, which is from 4 to 9 months in utero. And then myelinization and synaptogenesis. Now, myelinization is important as it often happens after the baby is born. And this is why the baby isn't born knowing how to juggle a soccer ball, for example, because myelinization has not happened yet. And this is something that happens in childhood, years after birth. However, just know for now, proliferation is the first step, followed by migration from 4 to 9 months, then myelinization and synaptogenesis, and these are the stages of brain development. Now, let's talk about teratogens. So, you might be familiar with some of these. So starting off with thalidomide, we have all seen the thalidomide babies. Thalidomide was basically a drug, I think it was for coughing. It was given back in the 1900s for pregnant women, and it caused their babies to be born with arm and leg malformations, and this is particularly high yield. And inshallah, these pictures are from me, they're not from the doctor. Obviously, this one is not in your slides as well, but they're there to help you memorize. Now we have warfarin, and the way I memorize this is that when you go to war, you wear a helmet. And so I associate this helmet with mental retardation and microcephaly. So warfarin causes mental retardation and microcephaly. It's a teratogenic drug, do not give it to pregnant women. Similarly, we have tetracycline, which causes teeth malformation. T for T, tetracycline will cause teeth malformation. Then we have heroin, which can cause fetal addiction, and I guess you might have heard about crack babies. As a rudimentary term, there is also other teratogens like viruses such as rubella, herpes, and varicella. Rubella, I memorized it by the see no evil, hear no evil monkey. You can see here. It causes cataract and deafness. So you can't see, you can't hear. This is rubella. Herpes is going to cause microcephaly, and varicella is going to cause both mental retardation and muscle atrophy. Other social drugs like alcohol will cause fetal alcohol syndrome. Simple. Smoking will cause spontaneous abortion, as for us. Radiation will cause genetic issues, so like chromosomal abnormalities, translocations, gene issues, and then mental and growth retardation. So let's talk about fetal movements. Now, originally, we said that the baby is very small. So even though the baby is moving, the mom cannot feel it. So movement will first of all be detected by ultrasound at 8 weeks. The baby is moving, but he's too small to actually cause force. The mom cannot feel this movement. This is at 8 weeks. Then we have fetal breathing movement at 10 weeks, arm and leg twitches at 10 weeks, hand-face contact at 10 weeks, stretching and rotation at 10 weeks. And the common denominator here is that they're all related to the arm. Almost all of them, except for fetal breathing movement. That's arm and leg twitches, so the arms and legs twitch, hand-face contact, the fetus will touch his face, and then stretching and rotation of the fetus as well. All of these happen at 10 weeks. Yawning happens at 11 weeks. Sucking and swallowing will happen at 12 weeks. Eye movements will happen at 16 weeks. All of this is inside the womb of the mother. And the mother can only feel the baby moving at 18 to 20 weeks. And this is when you have, moms saying they can feel their baby kicking. It's actually just the baby moving, because now the baby is big enough and they can feel it. And just another way to quickly memorize it is that the very basic things happen earlier. Breathing is very basic, so it happens at 10 weeks. Arm and leg, hand, face, stretching and rotation, these are not very complicated things. However, yawning, it requires coordination of muscles. Sucking and swallowing, it requires coordination of muscles. Eye movements, the eye is obviously very complicated, so it requires more time to develop at 16 weeks. So memorize everything here. There's no way around it, صراحة. And one way I can ask you about this in the exam is instead of saying when does yawning happen, I can give you, for example, I can say at 10 weeks all of these happen except for what? And I can name fetal breathing, arm and leg twitches, and yawning. You will choose yawning. Okay? So, to talk about fetal behaviors. At 36 weeks, which is very close to labor, the fetus, just like us, will either be asleep or awake. And we can divide this further into quiet sleep or active sleep, or quiet awake or active awake. And these will depend on three things: heart rate, eye movement, and body movement. Okay? So, to explain more, and you should have to memorize all of this, state F1, which is quiet sleep. This is very similar to the non-REM sleep that we go through. And you should know this from neuro, that you have non-REM sleep and REM sleep. Non-REM sleep is basically when you're just very quiet and relaxed, and you have a stable heart rate, no eye movements, very occasional startles, you're not moving. And this is more common as the fetus grows. So it goes from 15% at 36 weeks, 32% at 38 weeks, and 38% at term. Okay? And then we have state F2, which is active sleep. Now, active sleep is basically your REM sleep. Your REM sleep is when you're dreaming. So you're going to be having frequent heart rate accelerations, presence of eye movements. REM أصلا stands for rapid eye movements. Frequent body movements, مع إنه they're sleeping. This is because we have our muscles basically get paralyzed when we're in REM sleep, and this is why we're not punching the air when we're sleeping and dreaming. But babies don't have that yet. But during REM sleep, they're going to have frequent body movements. And what's really important here is that it's also the most common state, which makes sense because REM sleep is important for development. For the stage that correlates with the REM sleep is going to be the most common in babies. And it's going to be from 42 to 48% of the time. Then we have stage F3, or the state F3, which is quiet awake. This is basically when the baby is just a bum. The baby has no frequent heart rate accelerations. There is some eye movement because he is awake. There is no body movement, and it occurs really briefly. And this is why we call it quiet awake. Everything about it is quiet. Allahumma yani there is eye movement. State F4, or active awake, this is a very physically demanding state. So it's rare to see, and it's characterized by activity. So there's an unstable tachycardic heart rate with eye movement, and there's continual movement with activity. It goes from 6 to 7% at 36 to 38 weeks, and becomes 9% at 40 weeks. It's basically activity. Okay? Then we have the fetal senses. We have hearing. Hearing is actually one of the first senses to develop, and there is a response to sound from 22 to 24 weeks. And the way I memorize this is with a tuning fork. Tuning fork. So from 22 to 24 weeks. And babies begin hearing at a lower frequency from 250 to 500 hertz compared to us adults. Chemosensation is obviously difficult to assess because you can't tell the baby to open your tongue, give you some candy. However, they are able to differentiate between sweet and noxious sensations. Newborns have been found to prefer their mom's odor. And this is a common theme, a recurring theme we're going to see again and again, is that a newborn will always prefer the mom. SubhanAllah, they're just hardwired like that. Then we have pain, and neural pain pathways will develop at 26 weeks, and they will react to painful stimuli by moving away from it. So if you happen to touch a fetus with a needle, the fetus will move away from it. And this happens at 26 weeks onwards. And just to add on to the hearing point, they hear at this niche frequency to protect them, because the environment they're in is very noisy. There's the mom's intestines, and intestines are very loud, and basically it's just protection for them. Now on to the fetal senses. Come on, continued. Temperature, it's only anecdotal. Moms report more fetal movements when taking hot baths. There's no studies regarding this, it's just anecdotal. Touch is the first sense to develop at 8 weeks. Now the way I memorize this is when you're doing the number 1 with your hands, it's very similar to how you touch things. You touch things with your finger, with your index finger, and it's the same gesture you do to say first or one. It's the first sense to develop, which is high yield, at 8 weeks. Okay? By 14 weeks, most of the fetal body is responsive to touch. And then vision is the least likely stimulated because they're in a very dark environment. Now, on to fetal learning. Now, obviously, you can't give a baby Anki cards and see if it remembers anything. However, we can still assess learning through habituation. What is habituation? Habituation is waning of response to stimulus. So we do this by auditory stimulus, and this habituation in this context can be seen from 22 to 24 weeks, which is the same time period where Aslan they develop the hearing sense, as I told you, the mnemonic of the tuning fork. And there's also exposure learning, and as we said, baby will prefer the mother's voice, and they will have a music reference by 36 weeks, and mu 6, so 36 weeks. Okay, now we're going to be talking about habituation so much more later on. However, what you have to know for now is basically waning of response to a stimulus. So, like, let's say, as a very general example, you're standing in front of me, and I scream. The first time you're going to be shocked, you're going to be startled by it. Second time, you're going to be less shocked. Third time, nothing. Fourth time, you're just going to be annoyed. This is basically waning of response to stimulus. The response is basically you getting startled by me screaming, and the stimulus is me screaming, as a very crude example. Now, why do we care about all of this? Why do we have Aslan fetal learning? Why should the fetus learn? It's because it prepares them for life after birth. And it will allow them to recognize the mother, and it's very important in breastfeeding. If they don't breastfeed, they will die. Obviously, it's very important that they come hardwired with the things necessary to breastfeed. After birth, now the baby is born, we have motor development. Now, this is a mnemonic from Dirty Medicine, and just to go over it really quickly, at 2 months after birth, the baby will learn to raise his head. At 4 months, roll over. 6 months, the baby will sit up. At 9 months, the baby will crawl, and at 12 months, the baby will walk. Now, I didn't want to have to do this, however, the mnemonic is basically to sing this to the tune of Happy Birthday. So 2 months old, you raise your head, and so on. And this is the motor development slide. It's just copy-paste. You will have a guaranteed question or two from here. So if I were you, I would pause the video, and I would memorize this. You can use the mnemonic, but كمان you have to memorize both numbers. Like, okay, صح, it says 2 months old, raise your head. No, here it's 1 and 2 months. You can have a question that's just 1 month. And obviously, things will develop in order of importance. Things, حتى after birth. So, for example, lifting head from the stomach position is very important because if a baby sleeps on his stomach, he can suffocate. So it's really important to develop this early on. Then controlling head in the sitting position, rolling over, reaching for objects. 5 months is when the baby has no head lag when he is pulled to the sitting position. And you should know this from MSI, I think. 6 months, the baby can transfer objects from hand to hand. 6 to 8 months, sit independently. 8 to 9 months, begin hand and knee crawling. 9 to 10 months, pull to standing position. 11 to 12, use pincer grasp. This is pincer grasp when they can hold very small things, and this is important. Why? Because choking hazards. They can hold small toys and put it in their mouths. From 12 to 15 months is when they take independent steps. And come on, this is important because when the baby starts moving around, you need to baby-proof your house. When the baby can grasp things, you need to hide small toys, etc., etc. Now we're talking about more fetal movements, and please, if you haven't paused the video already, go memorize them and come back. We're talking about eye-head control. Now, at first, babies are very curious. They're very malagif, so they're going to be looking at anything they can, whatever they can. However, they can't really fix their gaze on one thing. So they look at one thing and then khalas, they're looking away. Then, at 3 months, they will develop focusing of gaze, also known as smooth pursuit, also known as eye-head control. So let's say you're playing with a baby, you're holding a toy in front of him. Before 3 months, you move the toy, the baby is still looking at the same direction. However, after 3 months, when they have smooth pursuit, you're holding a toy and the baby is going to keep looking at it, even if you move your head. Even if you move the toy, the baby will move his head with it. And then we have manual skills. So spontaneous motility at 6 weeks, and the way I memorize this is that motile is 6 letters, so 6 weeks. Thumb sucking and moving arms is from in utero aslan. And developing the ability to reach depends on posture control. Okay, and nothing to add here صراحة. Locomotion, which is basically movement, using your legs. So, it's the transition from infancy into childhood. خلاص, now the baby is a toddler, the baby is a child. At 7 to 13 months, the infant will pull to stand and begin cruising. And this is something we've all seen our younger brothers do, for example, or our younger sisters or cousins, where they basically hold onto a couch or a table and they begin moving with it. We call this cruising. The onset of walking, obviously, is later. It's from 11 to 15 months. And this development will depend on experience. So, for example, if you have a mom that whenever her baby stands up to walk, she runs over to him and is like, لا لا هلا بيوقع, and he's gonna fall and whatnot, the baby will never learn how to walk صراحة until a very later time. So let kids walk, and that's basically the takeaway here. Locomotion gives new info about the self and allows development of new ways to achieve goals. This was the first lecture. Easy so far. Now, your lecture, the first lecture, Introduction to Infant Development, is a little different than ours. It has like 4 or 5 new slides, but they're all blurry pictures of milestones, so I'm not going to be going over them. I don't think they're particularly high yield. However, you can still open the slides and go through them yourself. So, on to the second lecture, which is Infant Social Development. And a recurring theme is that humans are very social creatures. So a lot of learning, a lot of development has to do with socializing and social development. So what's the most important thing socially? People. And what's the most important thing when you're talking to someone? Their face. If I'm talking to you and I'm hiding my face, or I'm not making eye contact, or I'm talking in a very monotonous voice, for example, that's not good socialization happening. And you just keep this in the back of your mind. Now, babies, subhanAllah, they're hardwired to look at faces. And this is gonna cause attachment to bonding between the baby and the mom. However, something you have to know is that very early on, babies basically cannot see. They only see a mixture of shadows and contrasts. As they get older, months older, that's when they can actually start viewing objects clearly. Why is this important? Because of this experiment we have. Here we have 2 boards and they're being shown to a baby. A very, very young baby, for example. So a newborn will have this board shown to him. Now, can you take a guess at which of these images a newborn baby will fixate on? You might say this one, but it's actually this. This image shows the contrast and the shadows of the human face. And as we said, babies can't see anything except for shadows and contrasts, so they're going to fixate on this more. Nahna, because we're more developed, we will focus more on features, things that look like features, while very early neonates, they will focus on the contrasts and the shadows. Similarly, if you give them this board right here with the 2 pictures, you can guess that babies will look at this photo more because it looks more like a face. And just to explain here for a second, babies are drawn to things that look like faces. Hello? And it's more so about the symmetry and the alignment of faces rather than the individual facial features. And what's really particular here is that obviously this looks more like a face. We have a term for this. We say a face is top heavy. What does this mean? It means that most of the contrast and the shadows is around the eyes, around the hair, around the eyebrows. And this is why babies prefer looking at upright faces which have a top heavy appearance, rather than this one, which is upside down or inverted. And subhanAllah, this is also why babies are more drawn to females, as they tend to have smoother faces with more top-heavy appearance, while males tend to have facial hair, which gives them kaman bottom-heavy appearance. And what's also important is that faces are pretty dynamic, and you just have this moving face with different emotions that has sounds coming out of it, and this is very stimulating for an infant. And this is basically everything we said, just in words. Maybe the only thing is that just keep in mind for later that babies will form facial prototypes, which will be used as a reference. So, Something interesting happens in the infant. When the infant is first born, he or she will be hardwired to look at a face. Then this preference will be gone. Then it will reappear. Now, one explanation for this is that the baby very early on, like around before 1 to 2 months, the baby looks at faces based on instinct and based on reflexes. The baby doesn't actually understand what's happening. Then you have this shift from instinct to higher cortical regions. So the baby now can understand facial features. And there's a transition zone between them where it appears as if the baby has no preference for faces. So, in words, the infant preference to look at faces disappears by 1 to 2 months and reappears by 2 to 3 months. And this is when the higher cortical regions take over. 1-month-olds will be able to scan faces and look at the external features, so like the ears and the hairline. They can't really see the internal features of the face yet. This is for 1-month-olds. 2-month-olds will look at the internal features, things like the nose and the eyes, internal features. And as we said, they prefer to look at mom. And they will even start suckling when they only see a photo of her. Now to talk about recognizing mom, like this cute baby over here. So, for the newborn, recognition of the mom's face depends on seeing both the internal and the external facial features. This is for the newborn. Then the baby develops, the baby becomes more advanced. A 2-month-old can recognize the mom with only her internal features. Like if a mom covers her hair and her ears, puts on a hijab for example, the baby is still going to be able to recognize who his mom is by her nose, by her eyes, by her mouth. By 4 months old, they can recognize the mom with only her external features. So if they only see her ear or her hairline, they'll be able to recognize who the mom is. Recognizing the father is qualitatively different. It's different than this. It's a different process, and it develops later. Obviously, what's important here is that a dad should interact with his infant so that the infant can learn to recognize them. Otherwise, this will never happen. After age 2, children are more drawn to new and novel faces. Now, because infants are developing, their ability to recognize a face also improves as they develop, as they get older. So in their first year, their ability to recognize a face from different angles increases. Infants will rely on configuration more than individual features, and this is something I said when we talked about how symmetry and configuration is more important than the individual features. The right hemisphere is used during facial recognition. I think the photo is mirrored. I touched the right hemisphere. Infants will show the greatest interest in female faces of their own race, gender of the primary caregiver. This is also important to keep in mind. Now, we talked about recognizing others. Let's talk about recognizing oneself. At 4 to 5 months, infants can differentiate between moving images of themselves versus others. They still don't understand that this is them they're looking at. However, they can put 2 and 2 together and they can realize that, oh, whenever I raise my hand, that baby in the mirror also raises his hand versus a video of another baby. So this happens at 4 to 5 months. The infants can differentiate between moving images of themselves versus moving images of others. At 8 months, they will look longer at images of others. Here's an important principle that we're going to revisit throughout the entire crash course. Babies prefer to look at things that are new to them. They prefer to look at what is novel. So at 8 months, they look longer at images of others. This makes us theorize. They're starting to understand that, oh, this is a new face. But just memorize this for now and don't worry about the rest. At 18 to 24 months, infant recognition of themselves in the mirror becomes more advanced. This is when a baby can recognize himself in the mirror. Now, is pretty privilege real? According to infants, yes. By 6 months of age, infants will form a prototype based on internal features. 6 months is also when infants categorize faces according to beauty. And beauty is 6 letters, so 6 months. This is how I memorize it. Now, you guys know what a prototype is. A prototype is, if you've seen those images, they bring the average of like 100 faces, 1,000 faces, 1,000,000 faces, and they bring the average of them, the average feature. And this becomes a prototype. So babies will have this prototype by 6 months, and they will also categorize faces according to beauty. And you have beautiful people, you have not beautiful people. This is according to the infant. Regarding beauty, 12-month-olds will look longer at novel, attractive faces rather than unattractive faces, and even associate unattractive faces with negative attributes. وصراحة this is a compliment. If you've ever seen a baby look at you like in a mall, just a random baby staring at you with big eyes, this يعني you should consider because of symmetry and beauty. Facial expressions. Newborns can imitate some facial expressions at 1 to 2 days old. However, we think that these are reflexes because, as we said, a 1 to 2 day old cannot أصلا see. So you will be smiling at them, they will smile back, but this is probably just a reflex. They just, maybe just a coincidence that they happen to smile as well. However, moreover though, by 3 months, they can use a picture to differentiate between mom versus a female stranger. So the way I memorize this is that mom and pic are both 3 letters, so 3 months. Babies can also differentiate facial expressions, but this differentiation relies on the familiarity with the person portraying the facial expression. So it's easier to analyze a facial expression, so in happiness, sadness, if it comes from their mother rather than from another stranger. And it also depends on the emotional environment. Now, discrimination is not understanding. So just because a baby can discriminate between mom versus a female stranger, it doesn't mean that the baby necessarily understands that like this is their mother. They can just discriminate. Okay? To them, their mother is just the woman that they keep seeing around. Then infants from 4 to 7 months can categorize facial expressions according to emotions. So similar expressions convey the same emotion. So for example, the baby will start making categories. And this is how babies learn, by the way, and we're going to see more about this later. Babies make categories. So they have what's called a happy category, for example, where they will put and slap, they will paste every happy expression in that category. So for example, this is a photo of a person smiling with a very wide mouth, and this person is only showing his teeth. And there are different people with different expressions, however, they all convey happiness, so they're all going to be under the happy category. Your takeaway from this is what's on the slide. Infants 4 to 7 months can categorize facial expressions according to emotions, with similar expressions conveying the same emotion. However, for infants to be able to classify these expressions, they need to be prototypical when they're under 10 months. So in infants younger than 10 months, these facial expressions need to be prototypical to be classified. And obviously, infants will categorize happy expressions first. Why? Because the baby should live in a positive environment. The interactions with the baby should be positive. You should be happy when you're interacting with the baby. And this is why babies will categorize happy expressions first. Now, categorization of facial expression has some nuance. Infants under 8 months categorize facial expressions based on featural patterns only. So for example, they only see a smile. They only see eyes that are smiling. They don't necessarily understand the tarkiba or the collection, the collage of these features that makes a happy face. They're only relying on features. However, when they're older, infants over 8 months will categorize facial expressions based on featural expressive patterns. So, the baby will look at the entire face, the smile, the eyes, all of these will go into understanding a facial expression, and also any expressive features, such as, for example, someone is happy, they might also laugh, or they can speak in a high pitch or a high tone of voice. And they will also be able to match a happy voice to a happy face. If this was confusing for you, just memorize what's on the slide, particularly the underlined parts. Now we're going to talk about the still face experiment. The still face experiment, basically what we have is we brought a woman with her baby. Okay? We instruct the mom to play with the baby, and the baby obviously glows. The baby is happy, the baby is laughing, the baby is having fun with its mom. Then we instruct the mom to lock in, just go blank face, and we see how the baby just freaks out. The baby, first of all, is going to look confused. And she will start trying to catch the mom's attention by, for example, pointing at different things, by smiling, by laughing, and then khalas, the baby just gives up and starts crying and freaking out. And this, what does this tell you? It tells you that expressions are very important, and babies, they have basically this expectation in their mind of how a person should act. This sudden change in expression when the mom went still-faced made the baby confused. It made the baby freak out. Now, obviously, after this happens, the mom is instructed to play again with her baby and hug the baby to calm her down. And this is the reunion session in the still-face experiment. And the baby khalas will calm down at this point. So, we talked about this mainly. Eye gaze is essential for development of social bonds. Infants tend to look at the eye region. They make eye contact. And as we said, when the interacting person shifts away their gaze, the baby will smile less and look away. Yani, if you're disinterested and you look away from the baby will also become disinterested. They will sense this. Talking about social expectations, as we said, a sudden change in facial behavior has more negative impact than breaking eye contact. Yani, would you rather go still face, or would you rather look away from the baby? You would rather look away from the baby. Still face, as we said, they were playing, the mom went still faced, the baby freaked out, there was a reunion session, and what is high yield here is the behavioral changes during still face. The baby should recover during the reunion session. And during still face, you can obviously expect that the baby will have negative behavior. The baby will cry, the baby will scream. Emotions. So this is a very, very simple part. Alhamdulillah. Emotions start out simple, then become complex, just like everything else. So we have simple emotions, then we have self-consciousness. Self-consciousness is the ability to experience the emotion. Then self-conscious emotions, which is an emotion because of self-awareness. You cannot have these emotions if you are not self-aware. Emotions are important for the infant's social life. Yes, this is a high yield line, you have to know. And simple emotions, when I was studying BHS, I was so happy by the collection of these emotions because it's just the inside out cast. You have joy, sadness, disgust, anger, fearfulness, and surprise. So simple emotions are present at 6 months. This number is important. It should be in red, I think. With simple being 6 letters, so 6 months. That's how I memorized it. Joy is the first emotion to develop at 3 months, with joy being 3 letters, so 3 months, and obviously smiling due to excitement or happiness. Then sadness, because of loss of a desired object. So for example, you take away a baby's toy, a baby's candy, they're going to start crying. Disgust, which is important biologically speaking, because you don't want them to eat poison. Anger, from 4 to 6 months, this number is important, is adaptive. It's to overcome a barrier. Frustration and anger, biologically speaking, they allow you to overcome an obstacle. Fearfulness, from 6 to 8 months, is obviously more advanced, which is why it's from 6 to 8 months. Again, this number is important. And surprise is when there is violation of expected events. Maybe this is why peekaboo is also important with babies, because it's surprising to them. Let's talk about self-consciousness. Self-consciousness is the ability to experience the emotional state, and this occurs during the middle of the 2nd year of life. So this is about 18 months. And obviously, just because a baby is laughing does not mean that it knows, it actually feels happy. But when self-consciousness develops in the middle of the 2nd year of life, the baby, you can rest assured that they are experiencing this emotional state. The baby is actually happy. Let's talk about self-conscious emotions, then we're going to be done with this lecture. Self-conscious emotions, obviously, very advanced. It will occur during the middle of the 3rd year. And this includes complex emotions such as empathy, jealousy, and embarrassment. Self-conscious emotions can be due to evaluative or due to exposure. Now let me explain this. Exposure is when there is no negative evaluation of the self. Meanwhile, evaluative is when there is an evaluation of the self, obviously. To give an example, let's say a baby was in the shower. Let's say a person was in the shower, okay? And someone opens the door on them while they're in the shower. They're going to be obviously embarrassed. They're going to, cover themselves. There is embarrassment, which is a self-conscious emotion. However, this is called an exposure emotion. The person feels embarrassed not because they did something wrong. It's because they got exposed. It's because something happened, outside of their control. So this is exposure. Evaluative is more personal. So for example, let's say a child decides to steal a toy or hit another child. Then the baby is going to feel guilty. The baby is going to feel shame. The baby is going to feel a negative emotion. Hello? Why is this? Because the baby can evaluate his actions. So for example, let's say a baby stole a toy. The baby will then understand, or the child will then understand, that they chose to steal a toy when they know that it's wrong. And it was entirely in their control. They did it out of their own free will. And if all of that didn't stick, don't bother knowing it, don't bother memorizing it. Just know there is exposure and there is evaluative. Evaluative comes with evaluation of the self, evaluation of the actions. What's important though is that boys externalize while girls internalize. So boys, let's say there's a 3-year-old boy. You tell him, why did you do this? Why did you do that? He's gonna start pinning the blame on someone else. They're gonna externalize the emotion, externalize the action that happened. They're gonna say they forced me to do it. They're also doing it. Internalization, which we see more with girls and girl children, they will feel like it's their fault. They will get sad. They will say, yes, you're right, it's my fault. I did this. I am a horrible person. This is internalization. So just know this in red. This is basically what we said. Now, self-conscious emotions, to give you some examples, we have shame, guilt, and pride, for example. Shame is something common in our society. Usually, Arab culture is a culture of shame, a shame culture, where people, if they do something bad, they will be ashamed of themselves, their entire selves. So they will make a painful global attack on self-esteem. Yani if you make a mistake, the entirety of you is, let's say, worthless. Meanwhile, guilt, which is more common in Western societies, the judgment, the child judges a specific action or attribute as wrong, and the focus is on a particular behavior or a part of the self rather than the entire self. So let's say in a baby that experiences guilt, they break a glass vase. Now the glass vase, if you go and ask them why did you break it, they can feel guilty and they're gonna feel bad about breaking it. They don't feel bad about themselves, their entire selves. They only feel bad about breaking it, and this is healthier. Pride is going to follow a positive self-assessment, and the baby will be happy with his own actions. Attachment, which I think is the last part of this lecture. We know that humans are social beings, obviously, and by 3 months, humans have an attachment. Humans have an understanding of the connection between faces and voices. By 3 to 6 months, they have knowledge about human faces. I don't think these are very high yield, but they're here. You never know what can be brought, know everything. The affectional tie attachment theory was described by John Bowlby. This is very important. It's underlined. It should also be in red. This was in 1969. صراحة, there's no way they can ask you about the year. And basically, the affectional tie theory of attachment is when there is a warm, intimate, and continuous relationship with the mother in which both find satisfaction and enjoyment. And obviously, this makes sense. Yani, any bond in real life, whether it's attachment or not, whether it's between a child and a parent or friends, it should be warm. It should be continuous. It should be something both parties find enjoyment and satisfaction in. So I can ask you a question in the exam. For example, who coined the affectional tie attachment theory? You will tell me John Bowlby. Okay? Bowlby is a name we're going to see command at the end of the crash course, but keep it in mind. Now there are 4 stages of attachment. Let's take a quick break. Okay, so we're going to be talking about attachment, and Bowlby, the same guy that coined the affectional tie theory we just talked about, said that there are 4 stages in developing attachment. There's the pre-attachment stage, which is from birth to 12 weeks, attachment in the making, from 12 weeks to 6 months, and clear-cut attachment, which is from 6 months to 24 months, and the 4th phase, which is from 25 months onwards. So, the pre-attachment stage is when the baby starts orienting to mom and following her and her voice. There is no attachment yet. It's just these two things, these two high-yield things happening. Then the attachment in the making stage, when the infant starts to get attached to one or more people in the environment. Then there is clear-cut attachment, which is the easiest to memorize. It's when the infant cries when separated from mom. And this is why babies, if the mom leaves for a second, they start crying. And then we have the 4th phase, which is from 25 months onwards. The mom is independent, the baby is independent, and the infant can now form more complex relationships. And subhanAllah, this is why in the Quran it says breastfeeding is until the 2nd year of life, until the baby is 2 years old. Because this is when the 4th phase happens and the mom can khalas leave and the baby isn't so reliant on the mother anymore. And please memorize this. So, again, when studying attachment, there was this woman called Mary Ainsworth, the scientist, that created the strange situation, which is a paradigm to assess attachment styles in the 1-year-old. It's basically an experiment, and to explain this really quickly, first of all, Mary Ainsworth, she is the scientist that coined the attachment styles. So when you have people talking about secure attachment, avoidant attachment, it's basically because of this experiment, because of the strange situation. The strange situation, what it does is basically there's mom and there's the baby and then there's a random stranger, and just ignore the stranger. So the mom and the baby are playing, and then she leaves the room, and the baby, which is 1 year old, is going to start crying. And the baby is just basically inconsolable. The stranger cannot help the baby just wants its mom. The mom comes back, and they have, again, a reunion session, which is when the mom hugs the baby and the baby is comforted. And all of this is normal development. So normal babies, they will cry when their mom leaves the room. However, when the mom comes back, they will calm down and they will have a healthy reunion session. What's not normal is in other types of attachment styles. Now, we just talked about secure attachment, which is when the baby is comforted by the reunion with mom, and this is healthy and typical of most people. Then we have ambivalent attachment. Now, what does ambivalent mean? Ambivalent means something is so and so. So there's an inconsistent relationship with the caregiver. So it's as if the baby likes, but also doesn't really like the caregiver. So let me explain. The mom leaves and the baby starts crying. The mom comes back. However, she cannot comfort the baby. The baby doesn't stop crying. So anyway, it's like it likes the mom because it's crying when the mom leaves, but it's also not being counseled by the mom. It's not finding comfort in the mother. So it's as if the baby doesn't really like the mother. Avoidant, which the infant distances himself from the caregiver and ignores them. So avoidant, as you can see here, I believe they will not cry when the mom leaves. And when the mom comes back, they will just avoid her. Disorganized, which is very miscellaneous, it doesn't fit any other category, and is only seen in seriously adverse environments, like war and very bad orphan cases. And this table you should read. It's from the internet, however, it's good. Then we have this guy called D.W. Winnicott. There's so many people here. However, D.W. Winnicott, he was special because he named 4 things that contribute to attachment and then are also important clinically because they are important in the patient-therapist relationship. So we have 4 things: the holding environment, good enough mothering, transitional object, and true self versus false self. The holding environment is basically that a mom should create a safe environment for her child in which the child does not feel judged. The same thing happens in therapy. The therapist should not be judgmental when dealing with the patient or the person. Then we have the belief of the good enough mothering, which states that a good mom doesn't really have to be perfect, she just has to be good enough. She just has to be consistent and available and non-judgmental. Again, judgment is very important, as you can see. There's also the transitional object, which is an object that brings comfort in the absence of the caregiver. Now, maybe as a baby you did this yourself, but you probably held around a blanket or a toy that you would just take anywhere, to the mall, to the restaurant, to school. And in therapy, we can see something very similar when let's say the patient experiences distress. However, they take out the business card of their therapist and they read it and they see the number and they calm down because they have a transitional object. This is something that brings them comfort in the absence of the caregiver or the therapist for adults. And this is a very high yield example. Then we have the true self versus the false self. And basically the true self is who you actually are, and the false self is who you are around strangers, around people you can't really be the most comfortable with. Then some miscellaneous things from this lecture. Fathers, obviously, they play a role. And fathers, they're important for providing a sense of security. So basically, moms tend to cuddle with the child more. They tend to feed the child, take care of their needs. Fathers, they play with the child more. They get them excited. They play with them. They roughhouse with them, and they also provide a sense of security. Other family members and teachers are also obviously important in the development of the infant. The baby's aunts, grandparents, uncles, and then friendships. Friendships, not just in childhood, at any time, they should be reciprocal, two-sided. They should be diverse. You should have multiple friendships, and they should be goal-oriented. And obviously, the social network is going to affect the child. So, for example, our culture is that we tend to be more loud and expressive, and our faces are just so dynamic with emotion. Meanwhile, Scandinavian culture, or for example, some parts of Asian culture, they're what people describe as cold. So they're not really gonna have really different facial expressions. That was it for infant social development 1. Let's move on to 2. And this one is about play. Play is very important in childhood development. I think it's the UNICEF, they describe the right to play as one of the fundamental human rights for children. So, play in the first year of life, there's 2 types of play. There's explorative play and then symbolic play. Explorative play is when they're basically just seeing the properties of the toy they're playing with. يعني they're moving a rattle for the noise it makes. This is explorative play. Symbolic play is pretend play. This is when they're older, because obviously it takes someone that understands cognition. It just takes someone with a functioning. How do I say this lightly? It takes someone with advanced mental abilities to be able to pretend play and pretend that, for example, oh, I'm a policeman, you're a thief, for example. Pretend play. And symbolic play will become more advanced in the second year of life. It goes through stages. It can be distant from the self. So instead of pretending to feed myself, I'm going to pretend to feed my baby brother, for example, or a doll. Distant from observed properties of an object. So for example, I'm going to hold up a banana to my ear and I'm going to pretend it's a telephone. And distant from overt actions. So for example, I'm going to hold a pencil and I'm going to pretend it's an airplane. I'm going to pretend that it's flying and I'm going to make a whooshing sound. So, and also, this also means that instead of actually acting out the action, you can just say that you did it. So for example, a child, instead of actually feeding a doll, she will just say, oh, I already fed the doll yesterday. She doesn't need to eat now. But these are not as high yield as this, which is the PDF that the doctor was talking about. This is very high yield, and I just want to take a second to cover it. In self-directed, actually I'll explain once again. Exploratory play, we said, is the more basic form. Symbolic play is pretend play, which is more advanced. Exploratory play has 4 subcategories, and so does symbolic play. That makes it easier to memorize. So the first category in exploratory play is unitary functional activity, which is when we produce an effect that is unique to a single object. So for example, you have a ball. What do you do with a ball? You throw it. Or you have a telephone. What do you do with a telephone? You dial it. So it's basically just playing with the object as intended, as it was made to be. Okay? Then we have inappropriate combinatorial activity, which is when we bring 2 objects that do not go together. So you can see that this is the second stage. For example, we put a ball inside of a vehicle, inside of a toy car. As the baby progresses, though, we have something more correct, which is the appropriate combinatorial activity, which are objects that go together. So this time I'm going to place a person inside the vehicle, or I'm going to place a lid on a teapot, or I'm going to stack nest blocks together correctly, as I'm supposed to combine these 2 things. Okay? And then transitional play, which is, it's the stage directly before pretend play. However, without confirmation. Like, it's almost pretend play, but the baby is just missing one tiny thing. So, approximation of pretense. Pretense is very similar to pretend play, but without confirmatory evidence. So the baby is going to put a telephone receiver to the ear, but they're not going to speak into it. If they speak into it, that becomes pretend play. They're pretending that they're talking to someone on the phone. Now for symbolic play, we have self-directed pretense, which is the baby is basically the center of the play. So I'm going to pretend to feed myself. I'm going to pretend that I'm drinking. Self-directed pretense. Then we have other directed pretense, which is an object or another, just something else, another object is the center of the play. So I'm going to be playing with a doll, or I'm going to be playing with a vehicle. So the focus is on the doll instead of me. Then we have sequential pretense, which is when we link 2 or more pretense actions. So I'm going to dial the telephone and I'm going to speak into it. Remember what we just said? And then we have substitution pretense, which is a pretend activity involving 1 or more object substitutions. So remember when I gave the example of holding a pencil and pretending it's an airplane. So obviously the baby knows that pencils cannot fly. They cannot make a whooshing sound. They cannot do anything. However, they're going to pretend that it flies. And they're going to pretend that the pencil is an airplane, or they're going to pretend a block is a telephone, or they're going to pretend a banana is a telephone. Okay? Now, you have to know what each of these stand for based on the examples I just told you. And you have to know which ones get more frequent. So for example, you see this is 25, it becomes 21. This is 44, it becomes 27. This is 44%, it becomes 57%. And you can be asked about this. Which one is more frequent in 20 months? You will say transitional play. You will not say appropriate combinatorial activity or unitary functional activity. Okay? And basically there's 3 of these plays, types of playing, that get more frequent as time progresses. Transitional play, other directed pretense, and sequential pretense. And the mnemonic for this is just TOS, because they all increase as the baby gets older. I don't think I'm missing anything here. So just, it's a very simple PDF ترى. Just know the examples, they make sense. They start from more basic to more advanced. So let's talk about the functions of play. We have 5 domains in play: the intrapsychological domain, the mastery domain, the cognitive domain, the social domain, and the cultural domain. And I'm going to explain all of them quickly before going through them. Intrapsychological domain, and I want you to really focus on this, is all about emotion. It's all about emotion. Whenever you see something in the exam talking about emotion, it's intrapsychological domain. Particularly joy and positive emotion. Then we have mastery domain, which is basically when there's a goal-oriented thing. So, for example, you give a baby a puzzle, and the baby finishes the puzzle. This is a mastery domain. The baby learns how to finish something. The cognitive domain has to do with language and imagination. Do not make the mistake of saying language is related to the social domain. Social domain is about relationships. It's not about language. Language comes under the cognitive domain. And also imagination and divergent thinking, for example. Social domain is basically social relationships, so turn-taking during conversations. And you know how some people, when you're talking to them, they basically don't give you a turn to speak, they just monologue the entire time? So these are people with a problem in their social domain function of play. Cultural domain, play can transmit information about culture and gender roles. So for example, one important cultural toy that most girls grow up with was fulla, for example. And it's culturally appropriate because she happens to be wearing culturally appropriate clothes, abaya, for example. And she was basically, advertised as this Muslim Barbie. Anyway, language is cognitive, and intrapsychological domain talks about emotions. Social domain talks about turn-taking, and those are the really high yield points. Now, onto to a lot of words actually. The intrapsychological domain, as we said, is important for regulating arousal, yani emotion, solving conflict, expressing emotions that are mainly positive. Emotions during play should be positive. Why are you playing if you're not having fun? And also expanding emotions. They begin to feel a broader spectrum of emotions. Infants play an active role in starting and ending play. Yani if an infant wants to play with you, you'll know. They'll be looking at you, they'll be interactive. If not, they'll start shying away. Play partners are important. In the second year of life, play with adults continues to improve self-regulation, and playing with mom is going to bring more joy. However, by the end of the first year, there's also joy with peers. And in the middle of the second year until the third year, so 17 months until 3 years, there is more joy with peers instead of mom. Because peers, other children, when you're a child, they tend to be better play partners. Because moms get bored, they get tired. Children do not get tired. They're good play partners. Mastery domain, as we said, is self-efficacy and goal-directed. It's all about those things. Parents stimulating infants at 6 months will predict their persistence at solving tasks at 13 months. And peers better at unstructured play. Now, the takeaway here is basically, if you never learned to finish puzzles as a kid, you might grow up into a student that doesn't finish his lectures. And talking about the cognitive domain, it's all about acquisition of information and skills. So during play, moms will teach babies about objects and how to use them. So this is a spoon. We use spoons to eat, for example. Peer and sibling play will also help with acquiring info after the first year. And divergent thinking and creativity can be seen in the cognitive domain, and this is more with peers because kids have a wilder imagination than adults. Representation and symbolic play is important for developing representational thinking. This is also under cognitive domain. Pretend play is noted in the second year of life, with older siblings being better partners in symbolic play at 2 to 3 years. Language development, as we said, language is under cognitive. Playing with mom enhances use of language. Studies show that verbally responsive moms with their 13 and 21-month-olds have better vocab. At the end of the preschool years, peers use language as the central medium to enhance symbolic play. And just a quick way to get oriented and memorize things. Whenever we're saying peers, it's around the first year of life. Whenever we say siblings and pretend play, we're talking about the second year of life, sometimes the third. So, social domain, we said reciprocal communication, turn-taking. Towards the end of year 1, some games reinforce reciprocal communication, yani it's getting there, but towards the end of year 2, peer communication during play becomes reciprocal. It's now advanced. Social understanding, play will help children convey their own and seek to understand others' thoughts and feelings. Cultural domain play enhances understanding of cultural values. After the second year, pretend play transmits information about routines and role gender specific. Onto communication. Communication is part of social development, obviously very important. Fetuses can hear mom's voice and her intonation. And you guys know what intonation is. It's basically how your voice rises, for example, when you're asking a question, or your voice stays constant when you're just saying a statement like I am right now. Infants will respond to contours even in unfamiliar languages. By 8 months, infants can differentiate between happy and angry faces. This is high yield. This happens by 8 months. At 3 months, infants will look at the mom's face for pleasure. At 12 months, they will look at the mom's face for information about the world. So they're going to see how the mom reacts, and that's going to go inside their brains. So if the mom, for example, this is an example I believe the doctor gave us last year. If the mom gets anxious about everything, or so as to say freaks out about everything, the baby will also learn the same. The baby will develop phobias, the baby will have anxiety, for example. More importantly though, point gestures and following gaze. By 8 months, the adult follows the infant gaze. So yani, the baby doesn't really follow your gaze, it's more you're following their gaze because they haven't learned it yet. By 12 months, the infants will learn to follow someone else's gaze. What does this mean? For example, you're face to face with a baby, and then you look to the side. So the baby is also going to look to the side. They're going to look at what you're looking at. They're going to follow your gaze. Regarding pointing, which is super high yield, at 12 months, the baby looks at the hand of the person pointing. Yani you're pointing to a baby. The baby is not looking at the direction you're pointing at. They're just looking at your hand. However, at 14 months, the baby can follow most pointing gestures. You point at a toy, they look at the toy. And this is at 14 months. Interpreting the point develops in the second year of life. Also, 14 months is in the second year of life. It's from 12 to 24, so it makes sense. Now, learning to communicate through language, we have the first sounds. This is from your slides. We have 5 stages. Stage 1, which is from 0 to 2 months, is reflexive vocalization. The baby is just making noises out of reflex. Stage 2, which is from 2 to 3 months, is when the baby starts cooing. And you guys know what cooing means. It's basically the sound of the pigeon. The way I memorize this is that coo, C-O-O, is 3 letters, so 3 months. So 2 to 3 months. Stage 3, from 4 to 6 months, the baby is going to start experimenting with noise. What does this mean? This means laughing, this means blowing raspberries, and doing other things that are not speech just yet. So experimenting with noise, like haha. Haha is 4 letters, so think 4 months. So it's from 4 to 6 months. Stage 4, from 6 to 7 months, is babbling of canonical syllables. And just count the number of letters in babble. You're going to get 6 letters, so that's 6 months. It's only until stage 5, which is around 12 months, that they start speaking in jargon. You guys know what jargon is. They're saying random words that make no sense together. And what's also high yield here is that I can tell you just stage 5, and you have to tell me jargon. You have to tell me 12 months. So also know the order. Now communication, I think we said most of this. the first gestures a baby will do are not symbolic, they're very physical, like showing you something, giving you something, pointing to something. And in nonverbal kids, they can use this in place of vocal communication. Now, regarding word learning and social understanding, around 12 months, the baby will start speaking their first words. And this is usually similar across cultures. Guys, all of us, our first word was always mama. Maybe a few of us, they said baba first, dada. Following gaze helps in word understanding because, the eyes are very important socially. Eye contact is important. Communication is a social skill. Thank you. Early comprehension. When does comprehension begin? Early on. By 6 months, the babies will have formed an association between the parent and their name, and this is high yield. They understand 50 words by 12 months, and they understand 150 words by 16 months. The way I memorize this is that parent, mother, and father, they're all 6 letters, so 6 months is when the baby forms an association between the parent and their name. And they know that if I say mama, I will see this person in front of me. Or like this woman that keeps saying mama is this specific person, because they can't really speak it. Moving on, infant cognitive development. So what is cognition? Oh, and this is the 4th lecture, I believe. Cognition is all about acquiring, processing, storing, and using information. It includes memory, thinking, problem solving, categorization, reasoning, and language development. There are 4 approaches to understanding cognition. We have Jean Piaget, this very French name, Jean Piaget's, I'm just going to say Piaget. Piaget's sensory motor approach, Nativist approach, information processing approach, and psychometric approach. And we're going to talk about all of these, don't worry. So regarding Piaget's sensory motor approach, basically, Piaget said that babies learn by experiencing the world. And this is why Aslan it's called the sensory motor approach, because it's all about the senses and it's all about motility. So when a baby sees something, it's going to learn what that is. If a baby tastes something, it's going to learn what that is. So what's going to happen is that sensation or sensory motor stimuli are translated into mental representation. Now, I think you've had this lecture in Neuro with Dr. Abdul Jabbar when he talked about the group of neurons that stands for Taylor Swift and other things. I hope you had it, because otherwise I'd be talking from my mind. Mental representation is basically a group of neurons that will stand for a specific thought. Hello? So it's not like you have one neuron in your brain that understands what an apple is. No, it's a collection of neurons. It's a circuit that stands for the understanding of an apple. And if you bring multiple mental representations together, you're going to have a scheme or a schema, which is basically categorization. So, مثلا, I have the mental representation of an apple, and I have the mental representation of grapes, and I have that of an orange and a pear. All of these will fall under the scheme of fruit, the category of fruit, for example. It can also be simpler than this. So, for example, the baby can develop a scheme of something like a dog. How? From multiple mental representations. So the baby will first of all see a dog. It will be able to hear a dog bark. It will be able to touch a dog's fur. And all of these mental representations come together to form the full image of a dog as a 4-legged creature that can bark, that has very nice fur you can touch. And this is basically a scheme. Other than just being collections of information, they can be processes, because aslan a scheme in English is basically a process, when someone is scheming. So they have, for example, a mental representation of an apple in their mind. Combine that with the chewing reflex or the representation for chewing, and you're going to be able to have a step-by-step process that allows you to eat an apple. This is very simply speaking. Now, all of this was just basically an orientation. I don't think you will be required to explain the way I did. However, you should be understanding what mental representation means and what scheme means. And mental representation is more simple. It's basically an image in your mind. Like if I ask you to close your eyes right now and imagine an apple, you're able to do so. That's the mental representation of an apple. Meanwhile, a scheme is more complicated. It includes multiple mental representations and it allows us to do something. And so the goal of the sensory motor stage, which is the first stage in Piaget's theory, is to develop objectification, and this happens by age 2, and this is very high yield. Developing objectification. What is objectification? Objectification is realizing that the baby is separate from the object they're seeing. So the baby at age 2 realizes that it is separate from their mom. It is separate from the crib where they sit. This is objectification, and it's the goal of the sensory motor stage. When this happens, the baby moves on to the next stage in Piaget's theory. And this is also why, for example, babies, they enjoy playing peekaboo when they're young, because they don't have objectification. One part of objectification is object permanence. However, objectification is just like the main broad thing. Moving on, we said all of this. We said, just to recap, Piaget talks about objects in a specific place, in a specific space, over the course of time and under the rules of causality. So cause and effect. The principal goal of his theory was to explain objectification, which is the knowledge of self and objects as being distinct, persisting across time and following causality rules. Thoughts, ideas, images, and even emotions are manifestations of neural excitation. We said this. A sensory image is a pattern of neural excitation with a characteristic activation of particular neurons, and this is basically a mental representation. Now, a cognitive process will inform the transformation of mental representations into more elaborate representations. You're basically upgrading them, and this happens when you grow older and you're exposed to more experiences, according to Piaget. Objectification is a major cognitive achievement. It takes place in the first 2 years. This is the sensory motor period, from birth until objectification is developed is the sensory motor period, and it happens through the development of schemes. This is high yield. Now, Piaget's sensory motor approach is composed of 4 stages. Notice how this says approach, because we have the sensory motor stage, the pre-operational stage, the concrete operational stage, the formal operation stage. Sensory motor is from 0 to 2 and is divided into 6 substages until objectification is formed. Pre-operational stage is from 2 to 7 years. Concrete operations stage is from 7 to 11 years, and then formal operations is from 11 years through the end of adolescence. Okay, so now we're going to be talking about the sensory motor stage, and we said that it's divided into 6 main substages. So, the sensory motor stage, from breaking down the name, sensory and motor. So how can I incorporate sensation plus movement together? So the first substage is the modification of reflexes from birth until 1 month of age. Now, this is where the infant engages in reflexive behavior repeatedly in response to stimulation. Gradually, the reflexes are adjusted to meet the requirements of different circumstances. Now guys, what I did, my approach to these coming slides is that I pasted the slide that the doctor explained on, so this, and then I added my own explanation. And the explanation is important, صراحة, because the questions do come from it. And this part might be a bit confusing because it's gonna touch a lot on schemes, and you're gonna feel like it might have some conflicting information. Just know what's written on the slide. You're not required to understand anything. Just memorize the slides as they are. So this stage, which is modification of reflexes, is basically just reflexes. The baby doesn't understand what it's doing. It's just you hold your hand up to the baby, they just grasp it. You put your finger in the baby's mouth, they start suckling on it. That is the stage 1, from birth to 1 month. You have to know the dates. Then we have stage 2, which is primary circular reactions. Now, there's a mistake here that I wish you guys can edit. And basically, primary means related to the self. Like me as the baby, I'm going to do things with me in the center of them. Circular means that something is repeated. And this stage, which is stage 2, happens from 1 to 4 months. This is when a reflex can become a scheme. And a circular reaction is a scheme that is repeated, as we just said. So let's just say a baby did something as a reflex. Oh, it did something by accident. Like, for example, the baby was playing around and kicking its feet, and then it accidentally put its foot in its mouth. The baby is going to start sucking on its foot, and it's going to enjoy this, right? It's going to find this pleasurable. So, this is an example of a primary circular reaction. We took a reflex and we made it a scheme. The sucking reflex is now a scheme, something the baby wants to do, intends to do. That's the key word here. Stage 3 is the secondary circular reactions from 4 to 8 months. Secondary means the baby is not the focus anymore. It's now something on the outside. And this is when production of schemes will result in a specific desired outcome. So there is a goal here, right? There's a specific desired outcome. So for example, this baby over here is holding a rattle, and you guys know what a rattle is, like the khashkhash. They're gonna hold it, they're gonna start moving it to listen to the sound of the rattle. That's the secondary circular reaction from 4 to 8 months. And just a quick tip on how to memorize them. You're gonna notice that a lot of the months in the sensory motor stage are related to the number 4. So 1 to 4, 4 to 8, 8 to 12, and 12 to 18, I believe, which you're gonna see in just a second. So stage 4 is coordination of secondary schemes, and this is when there is a goal and a plan to reach it, more explicitly than the previous stages. This is really important as it is a means and behavior. Yani we're combining secondary schemes so that we can reach a specific goal that we want. Okay? So instead of being a circular reaction, something we're just repeating for fun, now we're repeating this to get a specific outcome, and through a means and behavior. So the example here, which if you're finding this confusing, just know the example. The baby will now push a hand away to grab a toy, or it can reach up a counter for a toy. Stage 5 is the tertiary circular reactions from 12 to 18 months. And this is when babies become little scientists, right? So they're gonna be holding things and dropping them, not for fun, not so they can be messy and ruin your clean house. No, they're doing this to explore. So for example, they're gonna drop objects to see what happens. They're gonna play with food, and this is their way that they're gonna explore in. This is gonna signal novelty and exploration. Then there is stage 6, which is the beginning of thought or mental representation from 18 to 24 months. And this entire thing is high yield. The child is going to invent means via mental representation, and they're going to try different combinations of actions mentally, anticipating consequences without actually engaging in behavior. What does this mean? Instead of the baby having to drop a glass to see a break, it's going to imagine it, right? It's going to conceptualize this in its head. Moving on to object permanence. Object permanence develops through stages 4 to 6 of the sensory motor stage. So we said that we have objectification and then object permanence falling under it. Object permanence in stage 4, which is the coordination of secondary schemes. Object permanence exists, but with a cognitive error. What is it? It's the A not B error, in which the child will look for the object in the first place it was hidden, even if you change the place later. Let me explain. Take this diagram of the A not B error phenomenon. In front of you is this young child in his 4th stage of the sensory motor stage, and there's a toy car. You hide it under the napkin on the right, and the baby understands object permanence. They know that the car is still there, they just don't really know where exactly. However, they uncover the right napkin, the napkin on the right, and then in the same setting, with the same child, with the same toy, immediately after this, you're going to take the car and hide it on the napkin in the left, and the baby is going to reach for the napkin on the right. So this means they went for site named A, not the site named B, right? So this is the A not B error phenomenon. And then in stage 5, the baby is going to search the last location. So you hide it on the left, they're going to search the left. Hello? And they're going to overcome the problem of multiple displacements. In stage 6, the baby is so advanced that they're going to contemplate multiple sites before searching. So they saw your hand go on the right, they're going to search the one on the right. Before even searching, they just contemplated all of this. And regarding spatial organization, there's really nothing for me to add here. You just know that the spatial reference can either be allocentric, so an object or something else is the center of the universe basically, or egocentric, in which I'm the center of my own world, for example. And babies tend to be egocentric. And I might have said this example before. However, for example, if you are with a baby, for example, right? You have a younger sister, a younger brother, and they still have the egocentric way of thinking. Let's say you happen to be looking at a pencil, and then your baby sister happens to be looking at a ball. And now, because infants are egocentric, you're going to ask your baby sister, what do you think I am seeing? I'm looking at the pencil. The baby is going to say, oh, you're also looking at a ball. Why? Because they're egocentric. This is a summary from the slides. As we said, infants learn through sensory observation, gain control of motor functions through activity and exploration. Biology and experience blend to produce learned behavior, and as they become more mobile, one schema is built after another. Critical achievement is the development of object permanence. At 18 months, they develop mental symbols and use words, symbolization. يعني, they create a visual image of a ball to signify the real object. This is symbolization, basically. It's a pretty advanced mental technique. The best way I can explain this is how in algebra, for example, we know that, you solve for x, we know that x stands for a value, it symbolizes a value, even though we can't really see the number. So this is symbolization. Obviously, they do it in a much more simpler way. Now, moving on to the stage of pre-operational thought, which, as we said, is from 2 to 7 years. Please note the number. So basically, children in this stage, they basically have cartoon logic. They don't really understand logic. They don't understand cause and effect. It's just all creative thinking. It's whatever is going on in their minds. Yani, they might jump off from a counter or a building thinking that they can fly. And they will feel like any bad deed they will do will be punished. So this is called imminent justice. Even if nobody finds out, they're going to be harmed for doing a bad deed. And they also think that everyone views the universe the same way that they do. Okay, so for example, and this is an experiment that they did with children, is that, for example, let's say there's an adult, like there's you, and then there's a baby, and you are looking at a pencil while the baby is looking at a ball. So you ask the baby, what do you think I am looking at? The baby will say, oh, you're also looking at a ball. Hello? But they think that everyone views the world the same way they view it. And they, as we said, they have magical thinking, egocentric, and they are unable to grasp the concept of sameness. And maybe you had this as a child, like for example, when you saw your teacher in the supermarket and you just freaked out, like, how are you here? You're supposed to be in school. So for example, they're not going to be able to understand that the same doll in the crib, car, or chair seems like is the same toy, essentially. To them, it seems like it's 3 different dolls. And no logical thinking, no cause and effect, and they just have creative thinking. Moving on to the stage of concrete operations, which I believe is from 7 to 11 years, they basically have now operational thought. Yani, they're more logical. They can form logical conclusions, like this one over here. All horses are mammals. All mammals are warm-blooded. Therefore, all horses are warm-blooded. Warm-blooded. This is a conclusion. They're able to reason and follow rules and regulations. They begin to develop a moral sense. This is very high yield. The moral sense, as we're going to see, matures as the person grows older. However, it begins to develop in the concrete operation stage. So when the child is 7 to 11 years old, they start to achieve an understanding of conservation and reversibility, and they begin to understand the concept of quantity. What does this mean? Have you ever seen the video of, like, when they bring a tall glass and then a short glass, a white glass, sorry, and they pour the same amount of water inside of them, and they ask the child to point at which one has more water? Now, children before the concrete operation stage, they're going to point at the tall glass and they're going to say this one has more. Meanwhile, this child, who happens to be in the concrete operations stage, will point at both of them and say they both have the same amount. Formal operations is when thinking is formal, logical, and systematic, and this is the stage, I think, from 11 years until the end of adolescence. This is when people can think abstractly and reason deductively. Abstract thinking is the main thing here. They can grasp concepts of probability. They can use language in a complex manner, and not all people enter this stage. So that was it for Piaget's theory. We're going to talk now about the nativist approach. Now, what does the nativist approach mean? Also, what does nativist mean? Native means something intrinsic. So this approach believes that babies are born with the knowledge they need. And the way the slides explain it, a limited number of early emerging kinds of knowledge form a central core, so core knowledge, around which more mature, diverse cognitive processes are elaborated, looking at the way objects obey physical constraints and extrapolating from there. In simple English, this means that babies are born with this core knowledge inside of them, and they build on that knowledge as they learn more about the world. Now, this is a very high-yield diagram. صراحة, it does not need explanation. You can just memorize it as it is. However, I will explain it. And if you don't understand the explanation, don't rewind the video. We're going to talk more about something similar later on. So, What you have to understand, first of all, is that babies tend to look at what is new to them. They look at what is novel to them. They look at what is unfamiliar to them. Okay? So, we did this test in which we brought a box and we hid a rod underneath it, behind it, sorry. And we brought in two babies. One of them is a newborn, and then the other is a 4-month-old. Now, we showed them the rod behind the box, as you can see here. And then we looked at what they look at for a longer time. And as we said, they look at things that they haven't seen before. So the newborn looks at the longer rod longer. That was a tongue twister. The newborn will look at the longer rod for a longer period of time. This means that the newborn baby, was basically seeing this segmented rod rather than this full rod. Okay? They didn't really understand that the rod is supposed to be connected. Meanwhile, the 4-month-old, even though it's a very young age, they looked at the split rod, this one, for a longer period of time. This means that in this experiment, they understood that the rod is supposed to be continuous, and even though they couldn't really see it, they saw the entire rod as one continuous object. Okay? And basically, we took this model, and then we presented this model to the babies. Then we moved it away, and we presented these two rods, and we saw which ones they look at longer. So 4-month-olds, they will look at the split rod longer. This means this is new to them. This means they saw the continuous rod in the previous display. Meanwhile, newborns will do the opposite. Okay? The entire point of this is that at a very young age, the babies are able to understand the concept of continuity, for example. And so they're born with it. This is the nativist approach. Again, if you didn't understand this, don't bother, صراحة. Just understand that newborns will look at the longer rod and 4-month-olds will look at the split rod. Let's talk about imitations, which صراحة is fun to study. Now, imitations, they're of two kinds. We have true imitations and we have deferred imitations. True imitations are the more simple kind. So basically, you're looking at a baby and you stick out your tongue and they copy you immediately. That's the key point. They copy you immediately. That's true imitations. You're in front of them and you're copying each other like a mirror. Deferred imitations is more complicated. The baby sees something happen in front of him, and then a day or two passes, and then he copies that. To give an example, let's say that this sweet little child went to daycare, and he saw a child having a temper tantrum and breaking plates. Okay, at daycare. A week later, at home, the child, this one, has a temper tantrum and starts throwing plates around. This is deferred imitation. Okay, it's imitation that happened after the event, like a good while after. Why are these important? Because they signal learning as well, and we can capitalize on deferred imitation to assess if an infant recognizes this thing that has happened, if an infant has memory of this experience. Because again, as we said, you can't really ask fetuses, you can't really ask infants if they remember something, you can't give them Anki cards, you have to see if they recognize things. So, the two scientists differed when talking about imitations. Piaget, who had the sensory motor approach, and Meltzer and Moore, who had the nativist approach. Again, no way they're gonna ask you about this number, but I kept it just in case. Piaget said that a baby has to first develop mental representations, then they will be able to imitate actions. So imitation comes later on. It's more so an end goal in development. First true imitations are from 8 to 10 months, and then the capacity to imitate novel actions is at 9 months. The way I memorize this is that novel and 9 both begin with the letter N. So novel 9. Deferred imitations, like the kid having the temper tantrum, is more advanced at 18 to 24 months. Okay? Then the nativist people said, look, mental representations are the start point rather than the end goal. So babies are born with an innate system that allows for imitating gestures. Because as we said, the nativist approach is all about being born with the information already inside of you. Then we have the information processing approach. Now the information processing approach, they don't go into detail in it in the lecture, so I'm not going to go into detail as well. The difference here is that it's not stages like John Piaget said. It's basically just the child gaining information like a computer. So here is an example. Let's say that a baby sees the white ball striking the black ball, and then he will see that the black ball is launched forwards. What is the baby going to infer from this? He's going to infer cause and effect. He's going to be able to tell you, if he can tell you, that the black ball was launched because it made contact, it was struck by the white ball. And this is the information processing approach. I believe we said all of this. And yeah, it's not really that high yield. Then we have the psychometric approach, which is important clinically. The psychometric approach aims to measure cognition in an objective way and compares the results to a comparable group. So this is very similar to IQ tests. We have something called the Bayley Scales of Infant Development, also abbreviated as BSID. And there's multiple versions of this scale, with the most recent version being the third, so BSID 3, which was developed in 2005. It's going to measure motor and mental development, and basically the way it happens is that test items, يعني مثلا section 1, section 2, they're arranged in a developmental sequence. So there's an average score, an average IQ score of 100, and it's suitable for ages 1 to 42 months. It tests 5 major areas: cognitive, language, motor, adaptive behavior, and social emotional. However, the most important thing in this slide, other than the name is important, is that the Bayley scale does not predict later IQ. So if someone does bad on this test, it doesn't mean they're going to have a bad IQ later on. Similarly, if someone scores really high, it doesn't mean they're going to score a high IQ when they're adults. Why? Because so many things can happen. A baby can learn more. Well, a baby can be taken out of an environment where they can learn. They can sustain a head injury, for example. So it does not predict later IQ. So now, also in the psychometric approach, as we said, you don't really ask a patient, you don't really give a baby exam questions. You have to measure their learning through something else. So for example, habituation, which we discussed previously. Basically, habituation equals learning. So if you show a baby a new toy they haven't seen before, they're going to be mesmerized by it. They're going to keep looking at it. Why? Because it's novel, because it's new. But show this toy to the same baby 20 times, they're gonna stop looking at it. خلاص, they're bored of it. They're gonna get used to it. And it's not only touch. They will also touch new toys more and touch old toys less because they're familiar with it. So this is basically what we just said. And older infants will need less looking time to habituate to repeated trials of visual display. And the faster they habituate, the better their brain integrity is. Now we have something in the slides that I'm not really going to explain. Just know it as it is. Familiarization or novelty preference procedure. Memory for a familiar stimulus and the ability to discriminate it from the novel one. So come on, this is something you can measure through habituation. The baby looks at the novel object and doesn't look at the old object it got used to. And what does this mean for you? To put it in very simple words, if a baby got used to something, it means it learned what this thing is. And that's basically it. And something else is that it's not just about one object, it can also be about an entire category. So for example, if you present a category the infant has never seen before, let's say vehicles. So you have toy cars, toy trucks, toy Teslas in front of the baby, and then you also have toy animals. The baby is going to touch the toy cars first. They haven't seen it before. Meanwhile, the animals, they've seen it, but they're not going to touch it. The takeaway is that you have to know that novel things will be touched first in a procedure. So we have 2 tests regarding the psychometric approach: the sequential touching procedure and the generalized imitation. Sequential touching procedure from 12 to 30 months. Basically, you will present the infant with samples from 2 categories simultaneously. And this is basically what I just told you. However, it's not really in the context of what is new. It's in the context that the baby can categorize objects into categories. Yani, remember the example we just said about vehicles as one category and toy animals as another? So what you're going to do is you're going to have like 3 toy cars and 3 toy animals, and you're going to see what the baby touches. SubhanAllah, the baby is going to touch the toy cars all together, and then they're going to touch the animals, even if they're mixed up. And they're going to touch the toy truck, then the toy car, then the toy Tesla, and then they're going to touch the toy zebra, the toy giraffe, the toy elephant. What does this tell you? They know the difference. They're able to differentiate between the two categories. So one category is vehicles and the other is animals, and this is the sequential touching procedure. This is how it's done. Samples from two categories simultaneously, and you're going to see what they're going to touch in sequence. That's why they named it this way. It's from 12 to 30 months. Generalized imitation from 9 to 20 months. The infant will be presented with a small model of a real-world object, and the experimental will model an action for the object. In simple terms, let's say an adult will feed a toy horse. Then the baby, after a while, will be presented with, for example, a toy cow. Now, a cow is not the same as a horse, but they fall into the same category of four-legged animals, mammals, something like that. Hello? They're in the same category. So the baby is going to take the toy cow and it's going to feed it as well. So what just happened here is that the baby generalized the action, feeding, to other members of the same category. Okay? And as we said, categories is how we learn and how we compartmentalize things in our brains. So this is why knowing what categories exist in a baby is important. Regarding information, this is not particularly high yield. I'm not going to read the salaha. The important thing here is that perceptual schemas and image schemas. Perceptual schemas are based on appearance, how you perceive something. That's perceptual schema. Image schema is based on function, the function of the object. That's how they categorize things. Okay, so we have these two ways to categorize: perceptual schemas based on the appearance of objects, or image schemas based on the function of objects. Okay? Then we're going to be talking about infant cognitive development too. So this is a very important slide. Guaranteed question from here, Salaha. Language, there's a couple important things in any language. We have phonology, which are the auditory units of language. So for example, the sounds we make. Semantics, which are the meaning of words. So I know that book means book, the thing I used to read. Grammar is how words are combined. So I don't say you is cold, I say you are cold. The way these words are combined is grammar. Pragmatics is how communications work. Now let me explain this. For example, if you're sitting with your friend and your friend says it's kind of cold in here, you're going to tell them, take my jacket. Or you're going to go and you're going to turn off the air conditioner. Even though they never said, can I have your jacket? They never said, can you turn off the air conditioner? It's just you understand communication so well that if your friend says they're cold, you're going to do something about it. Okay? And then syntax, I didn't see it in the slides, even though it's high yield from the practice questions. Syntax refers to the understanding the order of words. Okay? So for example, let's say the dog chased the cat and the cat chased the dog. These two sentences, they have the same words. However, the order is different and so the meaning is different. So talking about language, from birth to 6 months, babies don't really have language. They just communicate by crying. So if they're hungry, they're gonna cry. If they're sleepy, they're gonna cry. If they're in any discomfort, they're gonna cry. And however, it progresses. So from birth to 6 months, we know that language progresses from cooing to vowel-like sounds and syllables. We said babbling, remember? So babies will respond to sound by blinking, startling, turning, or crying. Emotional information and intonation in speech can alter their attention and response. And this is why baby talk is important, because it basically conveys emotion as well as information. Eye contact is made by 3 months. I is 3 letters, 3 months. Now, babies can perceive speech pretty early on. They're born with a universal ability to perceive language and prefer mom's voice. And subhanAllah, it's like babies pick up languages so easily. Some people theorize some sort of device in their minds, a specific circuit that allows them to do this. What's important though, again, from birth to 6 months, is that babies can understand phonemic contrast. What is phonemic contrast? It's telling the difference between vocal sounds. So for example, P and B. Like page instead of beige, for example. This is phonemic contrast. This is something babies can do under 6 months old. By 6 months, infants can recognize well-formed phrases and sentences. Again, these two are high yield. These two, you see them in 6 months. And they exhibit early word learning. So they make an association between the word, which is the sound pattern, the combination of letters, and their meaning. So they understand that mommy refers to mom. They understand that apple refers to the red thing they eat. Okay? Even though they can't really say it, they can still understand what it means. Then we have more about language perception. Language perception, what's high yield here is that detection of subtle properties of speech exists. Okay? Language perception will allow for the detection of subtle properties of speech. Okay? So, for example, when you're learning a new language and people tell you, oh, there's a difference between this letter, and you're like, they all sound the same to me, this is because you're an adult. Meanwhile, babies, they can detect these subtle things in speech. And regarding distinguishing sounds, 6 to 8 month old infants can distinguish any linguistic sound, even if it's not in their native language. However, this ability is lost in 10 to 12 month olds. Why? Because now the brain knows more about the native language, so they start filtering out what's not important. So, for example, if you bring in, let's say, a Chinese baby, they're going to be able to distinguish the sound of blood, for example. However, when they're 10 to 12 months old, they're not going to be able to do so because their brain now focuses on what's relevant to them. So, from 6 to 7 months, babies will produce canonical or reduplicated babbling. What does this mean? Gugu, gaga, mama, and dada. This is canonical or reduplicated babbling. Okay? Notice how it's the same thing. So, because this is a common trick in exams. For example, we're used to maybe saying guga, for example, or gagu. This is not canonical or reduplicated babbling. This is variegated babbling, and this happens by 11 months. So by 11 months, babbling becomes variegated with different syllables, yani variable syllables. So guga and babu, we see these types of babbles. And babbling depends on the input given to child. So for example, they can babble in Arabic letters if you're talking to them in Arabic, versus English if you're talking to them in English. But both deaf and speaking children will have verbal babbling. It's just innate. And these points are high yield. You should know this. Now, we talked about all of this. And what's really high yield is that by the end of the first year, babies will be able to segment words from fluent language. It's sort of similar to how you, right now, listen to a foreign language. You basically segment a sentence. Like, let's say I say a sentence in German, for example, right? You're going to take the one word you know, and you're going to understand it, and then you're going to start understanding the entire sentence. So you're going to segment words from fluent language. And also you have things like reduplicated babbling, following a point, distinguishing sounds. Now, from 12 to 18 months, there's an acceleration in the speed of acquiring new words. So they can learn up to 9 words per day, and this is when you want to sit them down and start reading books to them. They're going to learn the use of words in context, and they're going to begin to use words in a productive way. They're going to start developing a social pragmatic understanding. What does that mean? Asking questions, reliably following eye gaze, and pointing. This is all pragmatics. They're going to follow eye gaze between 12 to 18 months. And صراحة, sometimes you're going to see slides that sort of conflict, because we said that following eye gaze is at 12 months. Now it's from 12 to 18 months. That's what you really have to focus on, I would say, is the 12 months, particularly in the context of what is high yield. Learning new words in comparison to ones they already know, so they can also extend words into similar objects, categorical induction. Okay? So, around 2 years is also when they can start using adjectives and grammar. Even if they're making words up, you can still see that they have some understanding of grammar. So, for example, when a baby says this one is blickish, blickish is not a real word. However, it sounds like an adjective, right? So we can say this one is whitish, this one is reddish. That signals an adjective. And when a baby says this one is blickish, it means that they understand what an adjective is supposed to be. And they start understanding word syntax and question comprehension, which are not particularly high yield. However, this example, the adjective one, is high yield. Now let's talk about memory. So we have this concept called childhood amnesia, which is basically that we don't really recall anything from our early years, even though they're very important in our development. And so some scientists went out and gave us some theories about this. For example, Freud, which you're going to have more material about in the post-midterm, said that this is because of repression. However, this has been largely discredited, and we don't believe this anymore. Other theories on why baby memory is lacking: because the development of a sense of self takes a while. A sense of self is basically going to allow you to have memories. You can't have memories if you don't know who you are, right? So, linguistic abilities such as understanding what me and I mean and self-recognition happen later. So, for example, self-recognition happens at 18 months. Then we also have language development. Memories encoded before language development are tough to retrieve. Please remember this. Memories in the non-verbal phase of life, the pre-verbal phase of life, they're difficult to retrieve. Hatta now, if you recall any memory, the first thing that you remember, other than visuals, for example, is going to be what was said, right? And then neurological deficits and immaturity, this is also high yield. They cannot store memories because they're just babies, like their brains are not developed. Oh, and one quick thing here is that this is also why sometimes it's important to consider parental account of memories. So if your parents, for example, tell you about a memory, like, oh, when you were young, you'd always play on this blue swing, you might actually start having this memory of playing on a blue swing, even though it's fake, even though it's not an actual memory. So assessing memory in infants is tough for the millionth time, but we can infer memory through behavioral changes. And other procedures we talked about the sequential touching procedure, we talked about the deferred imitation, generalized imitation. Those are more about categories. Now these are about memory. So we have three things: visual paired comparison task, or VPC, operant conditioning, and deferred imitation. Operant conditioning, you know it as the Pavlov dog experiment, when he rang a bell and he rang a bell and the dog would start salivating. However, it's not explained in the slides. What is explained is deferred imitation and paired visual comparison. Now, deferred imitation will assess recall memory, and this is super high yield. Information retrieval in the absence of a cue. So as I gave you the example of the kid with a temper tantrum that started breaking plates, this is basically recall memory. The baby went home, and the other child that caused the tantrum was not there. So the baby had to recall out of his own memory that this is something that can be done, me smashing plates, for example. Okay? So, again, deferred imitation can test recall memory. This is different from recognition memory. Recognition memory is when an infant fixates on a novel stimulus, basically just recognizes something it has seen before. We can infer that an infant has forgotten something if the reaction is the same for the novel and the non-novel stimulus. As we said, babies tend to look at things that are new for a longer period of time. If they're looking at everything equally, manato, everything is new to them. Judging if an event has occurred previously, this is also recognition memory, and this definition is particularly high yield. Tested by paired visual comparison task. So recognition memory is tested by the paired visual comparison task. So know this. And this is not high yield. صراحة, if it comes, I told myself last year, if this comes, I'll just tank it, because I'm not memorizing all of those brain regions. However, the important thing here is that you have to understand declarative memory versus procedural memory, and I think this is in Dr. Vlad's lecture. Declarative memory is memory for events. Okay? So like, in 1999, this happened. Or last night, I had this for dinner. This is declarative memory. Okay? Things that have happened. And we have procedural memory, which is memory for habits and skills. So for example, riding a bike. That is a procedural type of memory. And it's going to survive damage to the medial temporal lobe. So you took this in neuro, that if someone has damage to this structure, or like the structure is necessary for memory, they're going to forget like who their family is. They're going to forget who they are, but they're not really going to forget how to button their shirt or drink or eat, because that's procedural memory, which is for habits and skills, and this is high yield. Now onto the sixth lecture, which is early and late childhood development, even though it only talks about early childhood development. So now we're done with infancy, and the baby has acquired a bunch of skills, and it's time for them to start developing them further and go to the real world. So this is in the early childhood development, which is from 3 to 6 years. By age 3, a child's representational world, which is made of mental representations, is a composite of many different things. They've just seen it all. They have seen so many things, their world is now rich. And this becomes the reference for processing biopsychosocial stimuli. And there's 6 steps for processing biopsychosocial stimuli. They're on the next slide. I'm going to explain them here though, and I need you to pay attention to this because it is high yield. So, Let's say you're this kid, and in front of you is this other kid. Now, this other kid is mean, they're a bully, they call you silly, okay? And when you're young, silly is like one of the worst insults you can use. So, you're first of all going to receive this stimuli. Your ears are going to pick up on what's being heard. So, this is the first step in processing biopsychosocial stimuli, receiving stimuli, okay? So, receiving stimuli is the first step. Then, you're gonna start forming an emotional response based on the stimulus. So this is the second step, formation of an emotional response based on the stimulus. Then you're going to start generating an initial output response. What does this mean? So the kid called you silly, you heard that, you feel upset about that, you feel angry. So what are you going to do? You're going to call the kid silly again. You're going to tell him into silly. Okay? And this is step 3, generation of an initial output response, which can be for example, vocalization, so you're calling the kid silly, or an action. So then there's going to be activation of 2 things. The first thing, which is the 4th step, there's going to be activation of your awareness regarding relationships. So you just called him silly. You're going to now think, how is this going to affect my relationship with him? Obviously, it's going to sour. This is his fault, yani. And then you're going to have activation, the 5th step, you're going to have activation of the capacity for self-awareness. So after calling him silly, after realizing that this is going to damage the friendship, you're going to tell yourself, you're going to ask yourself, is this in line with the person I want to become? Obviously not that deep because you're literally 3 years old. However, this is the 5th step. Then you have the 6th step, which is generalizing a final output response and basically integrating everything you've just learned into your brain again, building more representations. So for example, now you have the knowledge that, oh, if a kid insults me, I'm going to insult him back, and this is going to basically ruin the friendship. So this is new information that you just received, and you're going to add it to your biopsychosocial library. This is everything I said with words. Please know the steps. These 3 are particularly high yield. So the first step is receiving the stimuli, the stimulus. The second step is generation of an initial emotional response. The third is processing of mental contents into internal motivators that trigger the generation of initial output responses, so actions and speaking. And then we have activation of capacity for observation in relationships, activation of capacity for self-reflection, and construction of new representations involving final output responses and the response or lack of from others. So, in childhood, we have some major developmental tasks, and this is particularly high yield, this slide. So 2 really important things to do when you're 3 to 6 is that you have to develop an autonomous and valued identity. What does this mean? This is basically who you are as a person. You should learn to love yourself, and you should learn that this is me, I am my unique self, I am my own person, okay? And then you also have a gender identity. Gender identity, I think there's a definition for it later on. It's basically the unquestioned conviction that you are a boy or a girl, okay? And this happens during early childhood development. Now, more branches from these 2 major developmental tasks are, number 1, a sexual identity, number 2, peer identity. So like, who am I in a group? Am I the group leader? Am I like the friend that laughs around, that jokes around? And then also a conscience, which is your morals, right? And again, as we said, according to Piaget's concrete operation stage, I believe, morals start developing in the concrete operation stage. So it makes sense that a conscience is also going to start developing here around the same time. Actually, it's not really around the same time. This is, again, a point of conflict. Bas yani, just know this. Because, for example, the way I can ask you about this is, which of the following is not an early developmental task, an important developmental task in early childhood development? And I can give you these options: a conscious, a pure identity, a sexual identity, and then, for example, a social identity. You will choose social identity. That was not listed on the slide here. Then we have something called theory of mind. Theory of mind is this thing established between 4 and 4.5 years. And it's basically the belief that someone else can have thoughts and views different from your own thoughts. So what I'm thinking is not necessarily what you're thinking. How I'm feeling is not necessarily how you are feeling. And it's basically more awareness of the relationship between internal and external reality, and they use play to pretend about another reality. And by the way, guys, if I'm reading something, it basically just means that it's not really that important. Developing reality-based thinking. Regarding this topic, there's two types of parents. There's parents. Okay, let me give you an example first. So, for example, let's say you're a young kid and you're playing with a soccer ball inside your house, and you just so happen to break the TV. So, there's two types of parents that can be here, right? You can have a parent that is gonna come and take the ball from you, rip it, and start beating you, right? And then there's a parent that has the capacity for mentalization. This is an emotionally aware parent that has empathy, intuition, and can reflect on what has happened. So this parent is going to sit you down. He's going to tell you, or she is going to tell you, what you did is wrong. Explain to me what happened. Why did you do this? Okay? And maybe it just so happens to be that you are forced to play soccer inside. You're not allowed to be outside. And this is the root issue of the problem. So a good parent is going to be able to reach this conclusion and fix it. They're going to be like, okay, on Fridays I'm going to take you to the park, but no more playing soccer inside the house. A bad parent is not going to أصلاً reach this root issue. ولا سائل عنها. It's just going to beat the child and move on. Okay? Now, the environment should support the development of a child's identity. So the environment should allow for developing of the true self. Yani if your children are acting at home, that's kind of crazy. Developing delayed gratification, which is basically, should I have 1 marshmallow now or 10 marshmallows in 10 minutes? Fostering healthy narcissism. What does that mean? It means that there's awareness. You as the parent, you are aware of the child's aspiration to be perfect. Everyone wants to be perfect, child or not. And you're going to allow them from time to time to view themselves and also you as perfect. That's actually healthy for their development. And all of this is important in healthy development. Okay, so if a question asks about, for example, healthy narcissism, emphasis on healthy, you wouldn't say that this is abnormal. Moving on, I'm just going to read this part verbatim. Innate needs in the early genital phase, which is also development of the self and object relationships. Children tend to focus around their genitals at age 3. Toddlers are interested in exploring their bodies, and young children may manipulate their genital areas. Sexual identity, according to Stroller, is unquestioned conviction that a child believes they are male or female, also established at age 3. Now, I know we basically said that this was for gender identity. صراحة, it does make more sense to be gender identity. However, just know the definition as it is. Sexual identity is unquestioned conviction that a child believes they are male or female, also established at age 3. Issues such as exhibitionism, which is basically like in daycare, some children might tend to flash other children. There's also the issue of body privacy, body damage anxiety, curiosity, and development of peer identity. Moving on to a very high yield part, which is temperament. Now, you know when we say a person is easy or a person is difficult, فلان طينته طيبة طينته سهلة. This is basically temperament, right? So some people, some children, they're easy, some are difficult, some are slow to warm up. And these guys, Chess and Thomas, they basically put in place these 9 things to talk about temperament. And I'm going to explain all of this in a while. This is a very, very high yield slide. Guaranteed question from here. So please try to focus. So easy temperaments are basically those nice, quiet babies that are going to play with other kids, and they're just calm and nonchalant, and they're fine if they stay up an hour late, if you're late to feed them a bit. They're not really picky with food. They're not gonna annoy you, basically. Difficult babies are the ones where you have to do everything by force. بطلوع الروح يعني. You force them to get into bed, you force them to eat. It's just a really strange relationship. It's not enjoyable, it's just difficult. And then you have the slow to warm up kind. The slow to warm up kind, the way the doctor explains it, is basically like a frozen chicken, right? It has to warm up, it has to thaw outside. Slow to warm up kids, for example, you have a slow to warm up kid, and you bring them to a family function, or you bring them to a birthday party. Well, what's gonna happen is that they're gonna hide behind you for like 3 hours, and then yani, little by little, they're gonna start getting into the groove of things. They're gonna go play with the other kids around the 5th or the 6th hour of you being there. They're slow to warm up, basically. And I guess it makes sense. So now about these ones, because the examples are pretty important. I don't have them written, however, I am gonna say them, and they're in the notes. Basically, everything I've said so far is in the notes, by the way. So regarding activity level, some people are just slow. And this is what we call باليدين. They're just very slow. The world could explode and they're just going to be chilling and relaxing. Then we have rhythmicity, and this refers to biological rhythms more so than anything else. So for example, when you eat, when you sleep, when you use the bathroom, these are all very important for children. So for example, a child that is very strict on when he has to go to the bathroom, and otherwise he's going to start crying and shouting and hitting and punching, that is a child with a problem with rhythmicity. Okay? And oh, by the way, it's basically the collection of these 9 things that make us who we are, right? So you can have a high activity level, but like bad rhythmicity, for example. So basically, rhythmicity has to do with the timing of eating and sleeping and using the bathroom and stuff like that, biological functions. So then the other thing, approach or withdrawal responses. So this is basically the response of the kid to new situations. So as I said regarding the slow to warm up thing, these kids, if you bring them to a family function or a party, they're gonna hide behind you, right? Meanwhile, someone with better approach, they're gonna immediately go run and play with the other kids. And this is something my mom told me about my first day of kindergarten, which is when I saw the classroom, everyone was crying and hugging their moms, they didn't want to leave. Meanwhile, I just saw the other kids and I just ran and started playing with them. So that would mean that baby me had a good approach, okay? And then we have adaptability to change, which is basically flexibility. So are they gonna take an insane amount of effort, an insane amount of time to get into a new environment, or are they more flexible? Okay, that's adaptability to change. Then we have threshold of responsiveness and intensity of reaction. These 2 things are pretty related because someone that's intense usually has a low threshold, right? So you can just really easily push their buttons. You say the wrong thing and they just explode at you, right? And you have to walk on eggshells around these people. So obviously, threshold of responsiveness is basically the bare minimum you have to do to get a reaction out of them, right? To rage bait them. Intensity of reaction is how extreme they're going to be with how they act. So, for example, there are some quote-unquote over-dramatic babies where, for example, a child, if he has a full diaper for even a split second, he's going to start screaming like crazy. He's going to start bawling his eyes out and yelling very excessively. And then mood. Mood is just something intrinsic. You know, some babies, they're just happy, others are just grumpy, okay? And degree of distractibility, that's basically if they can focus well. This is not ADHD. It's more so about if they can focus on the task at hand. Some people just can't focus. And then we have persistence in the face of obstacles. And like we said, you give a baby a puzzle, you give a child a puzzle, sorry. All of these are about children as well. And the child is gonna persist even if the puzzle is difficult. And this is basically also gonna, you know, later on have to do with if this person is gonna have persistence in the face of obstacles. Not much to say here, Sabaha. And then there is this thing called goodness of fit. Goodness of fit is the compatibility between a child's temperament and environmental demands or parenting style. Yani sometimes, you know, when you click with a person, this is very similar to it. Sometimes kids don't click with their parents. So let's say there's a kid that is very, very shy. It's just how they are. And the parent, rather than being understanding, they're going to force them to go to every single event with 1 billion people. So this is poor goodness of fit. This is not good goodness of fit. Okay? Meanwhile, a parent with a goodness of fit is going to understand why their child is acting the way they are. They're going to basically make they're gonna make exceptions for them, let's say. And also, please know the name of the scientists, Chess and Thomas, because they can ask you who, for example, coined these things about temperament, and you will say Chess and Thomas. You will not say, for example, someone else. So now, the only high-yield thing here is emotions as facilitators of social adaptation. There is going to be achievement of self-regulation and social adaptation. Emotions are important for this part, socially speaking. Yani. You can't really have socialization if you have no emotions. And there's these other things. This says regulating anxiety becomes important, prominent between ages 4 to 5. Okay. Childhood, maturation and development of verbal language abilities. By age 3, they're going to use speech, thoughts, and behaviors to achieve a belief in their own ability to anticipate and predict events. What's important here is basically memory and recall. So we have two kinds of memory as well. We talked about the one regarding events and procedures, but كمان we have reproductive memory and we have reconstructive memory, and it's all about how you recall the memory rather than what kind of memory it actually is. So reproductive memory, they're going to recall the information from the past exactly as it is. So I ask you what you had yesterday, you tell me exactly what you had. Reconstructive memory is when they generate a fantasy based on a recalled memory and reconstruct the memory. Now, distinction, this is not lying. This is just the silly thing our brains do, that when you recall something, it might add some spices to it, right? So for example, you're fighting with someone, in a year, you're gonna recall it as, for example, you were fighting and it was also storming outside. This is reconstructive memory, okay? And then in childhood, we have the development of the superego. And all of this, as we said, is in early childhood from 3 to 6 years. So the superego is something you should take with Dr. Ali Jaratli. However, to go over it very quickly, the feeling of guilt experienced when they know the difference between right and wrong behaviors, they believe they had a choice between the two behaviors, and they have made the bad choice. And this is what I said regarding evaluative emotions. We also have superego anxiety, which is excessive guilt that paralyzes people. Yani they take the guilt of the world on their shoulders. And in this stage, it's important to foster self-responsibility and self-love. The last thing about early childhood is that there is adaptational capabilities. Okay, so for example, repression. Repression is important in Freud's theory, which is why you're taking it now as an introduction. Repression is an automatic, unconscious mental process that bars from conscious awareness those wishes and feelings that generate disapproval, or memories that generate unpleasant emotions. Yani, لا سمح الله, let's say you saw something really bad as a child, right? Like for example, you saw a dying dog and it just looked really disturbing to you. Your brain is going to repress that emotion. They're going to repress, your brain is going to repress that memory, okay? Repression begins to emerge at 18 months and becomes prominent at age 3. Now, repression is an adaptive response, but overuse sometimes occurs due to trauma. And this is the high yield thing I want you to know, the definition. And also, red stars are also basically red highlights, so you should know them. Now, on to the last lecture, which is late childhood, adolescence, adulthood, old age, and grief. And I personally like how this is structured. Like, we start very early on, we were talking about fetuses and babies, then children, and now eventually into adults and old age, and then death. So, the way I'm going to explain this is I'm going to explain the high yield things on these 2 slides, and then we're going to go through the lecture really quick just to see if I missed anything. But because the lecture is more so sawalif, I advise you to just read through the slides of the lecture after. I have them all here pasted. Okay. Bas, yalla, let's start about explaining this lecture. So, ignore the numbers, first of all. They're not exactly the same as the lecture. Don't let it confuse you. Now, we've all seen this diagram where it's this, boy in the cradle, and he grows up to become a child, and then an adult, and then an old man, and then there's like a grave at the end. And this is basically the lecture. In late childhood, children focus more on improving what they already previously have developed, right? So an older child that's not yet a teen, they will, they're gonna basically improve what they have already developed. Yani the things we talked about, like peer identity, gender identity, sexual identity, and this is when they develop their social identity. So social identity is in late childhood. This is high yield. Their neurons also will mature in 2 ways. First, they will become smarter and better at cognition, so they can understand logic and reason with you. Second, their myelin sheaths develop. Remember what I said about myelinization at the start of the crash course? This is when their myelin sheaths develop. So this is the time to put them into sports. This is Project Ronaldo starts at this stage, because they can now have better motor eye coordination. They have better fine skills, fine motor skills, because of myelinization. And that's it for late childhood. Then we have adolescence, which is basically puberty. And this stage obviously is marked by really big changes, both biological because of the pituitary gonadal axis and psychological. Adolescence is more psychological, puberty is more biological. And you can recall here the common issues that teenagers deal with. Maybe you've dealt with them in the past. Things like having an emo phase, which we call negativism. This is actually part of normal development. Teens, according to the lecture, teenagers will have an emo phase. This is normal. And this is also when they really mature in their social identity that they already developed in the late childhood phase. And also you can consider another issue like the role of social media and social issues like that. This stage is when humans fully develop their sense of morality. We said that the sense of morality develops in early childhood. It really matures and it fully develops in adolescence. Okay? So, regarding morality, it goes through 3 stages. When you're really young, you're gonna conform to principles, which is basically what morality is all about. You're gonna conform to principles because you want to obey your parents. Your dad said do this and I'll get you a toy. Your mom said do this and I'll be happy with you. So you're gonna obey these principles. Why? Because you want to obey your parents. This is the morality you have when you're young. Then it develops a bit. You start becoming sort of a hypocrite, right? So you're gonna act moral, you're gonna conform to these principles and these things just to have social approval of people. Because you learn that if you don't conform to morality, people are going to start disliking you. Then when you're older, in your adolescence, this is when you're going to have morality of self-accepted ethics, something like that. So basically, you now have your internalized belief system. You will start doing things because they're right, because you believe they are right, not because you want another person's approval, not because you don't want to upset your parents. You start doing things because of your own internal moral compass. That's it for adolescence. Let's talk about adulthood. Adulthood is the longest phase of life. It includes early adulthood, middle adulthood, and late adulthood, which is old age. So young adulthood is basically where you see yourself in the next 5 to 10 years. Actually, like 10, 15 years. It's from 20 to 40 years. And it's all about being done with the conflicts that you face in your teenage years. And the biggest thing on your mind in young adulthood is going to be things like graduating, getting a job, getting married, starting a family, and you want to be independent here and self-sufficient. This is in early adulthood. If you had a good upbringing, a good life up until this point, you'll have a smooth transition into growing older. Meanwhile, if it was full of conflicts, you're going to have conflicts again here. They're going to follow you, basically. Now, your young adulthood is all about work, and building a future. Your young adulthood is basically setting the stage for your middle adulthood. Now, talking about the middle adulthood, middle-aged people will now take pride of their previous accomplishments, as we just said. However, this stage, middle age, is about changing family dynamics, right? So changing family dynamics and reproductive changes. For example, when you're middle-aged, like I believe most of our parents are, your children start going off to college, right? And for a lot of us, that means studying outside. So this is going to affect the middle-aged person. If you're a parent whose entire identity was around motherhood, for example, or around fatherhood, you're going to experience what's called the emptiness syndrome. Your entire life was just raising these kids. Now they're outside of the house. Who even are you at this point, right? You're going to feel empty. Then there are other challenges. So for example, if you were a high achiever, you were basically a CEO and you really climbed up the corporate ladder so much, you're now president at age 55. What's left for you to do? There's nothing more. Khalas, you've reached the top, and you know the top is lonely, as they say. Now regarding biology and reproductive health, because this is also important, this is the age where females go through menopause. Now both men and women at this stage will also have reproductive changes, and they can go for cosmetic surgery, so like plastic surgery, and then also they're going to have a midlife crisis. And this is a midlife crisis is basically when they feel like they're stuck in an environment that they cannot control. And in a midlife crisis, you're going to see that these adults, they're going to start acting like children. They're going to start acting impulsive. They're going to start acting reckless, just like teenagers, basically. Sorry. And then finally, you have your senior years, which is, your senior years. Now, when you look at elderly people, you can really categorize them into one of two kinds. SubhanAllah, there's the healthy old people, and then there's the frail old people. And you have the people that get up and they walk to the masjid all by themselves, and they can make dinner and everything. And then you have those that they cannot get out of bed without a stay-at-home nurse, for example. And this period, old age, is all about senescence and aging. And some social problems occur here, like isolation. And I think we've all felt bad for the old people eating alone at steakhouse, for example. So isolation is a really big issue here. And then we also have ageism, which is like racism, but it's based on age. So some people may be shunned because they're old, and there's also negative stereotypes associated with old age. So, for example, maybe I just said one of them. Assuming that every elderly person is lonely and sad, that's also an example of ageism. It's also discrimination against them. And there's also the entire concept of retirement that people face at this age. The main issue here, though, is loss and grief, because unfortunately, when you're old, just everyone around you starts dying. And we're going to talk about grief here. And obviously, grief has to be one of the worst things to experience. And reactions to death can change based on the way a person dies. Like, for example, if a person dies really suddenly at a young age, it's gonna affect you more than if this was an old man that peacefully passed away in his bed, right? Similarly, if a person died by suicide, or if a person died due to illness or just because of old age. Now, we have these people, or this person, Kubler and Ross, who coined the 5 stages of grief, and we're all familiar with this: denial, then anger, then bargaining, then depression, then acceptance. Now, denial is okay. So I'm going to give an example here. So grief is not just for death; it can also be because of impending death, impending loss, right? So let's say that someone gets diagnosed with cancer, lung cancer, very poor prognosis. They're not going to make it. And the 5 stages of grief, we can see them here. So for example, let's say the patient, we're talking about the patient now, the patient that was diagnosed with a terminal brain tumor, for example, lung tumor. The first thing they're going to go through is denial. They're going to refuse to accept the reality of their loss. They're going to go outside. They're not going to attend their appointments. They're going to say, I'm perfectly fine. Nothing is wrong with me. I've never felt better. Then they're going to go through anger. They're going to feel frustrated and helpless about this situation. And this is particularly dangerous, especially theologically, because this is when someone can commit religious mistakes, right? Because they're just so angry. They just think it's unfair. Why did this happen to me? I don't deserve this. They're going to be angry. Bargaining is the next stage. It's when they're trying to negotiate or make deals in hopes of reversing or lessening the loss. So, for example, our patient here can go to the doctor and they're going to be like, doctor, if there's anything I can do just to give me more time, can I, for example, try this new medication, but I heard there was this new surgery that can lengthen my life, something like that. Or it can be religious. So someone can pray to God, like, for example, Ya Allah, please bring back this person and I will memorize the Quran, for example. So this is bargaining. Then we have depression. Depression is feeling deep sadness, hopelessness, or withdrawal after accepting the loss. And we all know what depression is. And then the last stage is acceptance, which is coming to terms with the loss and finding a way to move forward. So for the patient, this can be attending chemotherapy sessions. For a person that has experienced loss, it can be getting over the death and continuing life as normal. And subhanAllah, this is why it's important to have patience, especially at the start of something bad that happens in your life. Because regardless of who you are, if you're religious or not, we're all gonna reach the acceptance point at the end of the day. But it's really, the best person among us is the one that can exhibit patience, exhibit acceptance, exhibit good faith in Allah at the start of the problem, the musibah, basically. So to talk more about kids and grief, confronting the reality of death depends on the age of a child. Now let's talk in the context of Piaget's stages. So in the pre-operational stage, so like think 5-year-old kids, they think that grief is basically a really long sleep, right? They don't really understand that. In the concrete operation stage, from 5 to 10 years, they gain the sense of inevitable mortality, which is that death will happen someday, whether they like it or not. They start getting really scared that their parents are going to die, and then by 9 to 10 years, they completely understand that death can happen to anyone. By puberty or adolescence, which is the formal operation stage, the final understanding of death is present, an irreversible, universal process. In grief as well, we might do things like wearing the clothes of the deceased person. This is something we call internalizing the deceased, right? Sorry, this is identification phenomena. Identification phenomena is when we can wear the clothes of the deceased. Or for example, we can use an object that smells like them to remember them by. It's a way of us to connect with the deceased even though they're not around. There's this thing called we talked about identification phenomena, and there's this thing called internalization of the deceased, which is basically when the deceased is internalized. And this is like one of the last stages of grief. It's similar to acceptance, that خلاص, even if this person is not alive, is not on the earth now, they're alive inside of my heart. I'm gonna carry them anywhere with me, whether that's like the lessons they taught me, the emotional safety they gave me. That is internalization of the deceased. So this is basically the lecture. I'm just gonna skim really quickly through the slides. Late childhood is when they develop a social identity. You guys can just read the rest. صراحة, I don't want this crash course to be 10 hours long. I've heard enough last time. Maturation and development of innate needs. We're talking about physiological needs and emotionally pleasurable interactions and emotionally pleasurable sensory sexual stimulation and gratification. There's the development of physical capabilities. As we said, brain volume at birth is 10%. At 7 years, kids will attain 90% of the adult brain size or the activity. This is not that important, صراحة. The frontal lobe matures, which is where we have reasoning, where we have personality, everything. There's motor control, as I said. You can enroll them in sports at this point. And development and maturation of cognitive abilities. This stage in late childhood overlaps with Piaget's concrete operation stage, which is understanding others' perspective, developing more complex categories, reasoning logically, understanding concepts of reversibility, comparing past and present, understanding conservation of mass and number. Everything we talked about previously. There's also maturation and development of superego. In this case, it's development more so. Maturation more so. It's maturation of the superego that was already developed. So is the case for emotions, verbal language skills, gender, and sexual identity. Adolescence from 12 to 19 is profound biological, psychological, and social changes, overlaps with the formal operation stage, and it varies in onset from person to person. What's interesting is that if it's too early or too late, that can also cause psychological damage to the person. And it's divided into 3 periods: early from 11 to 14, middle adolescence from 14 to 17, and then late from 17 to 20. Puberty is physiologic, adolescence is psychological. Now, adolescence is marked by all of these normal things that happen during adolescence. So if you have an exam, which of these is not normal, you can cancel out all of these options. So we have psychosexual development, cognitive and personality development. So there's going to be a change in the pattern of thinking, and there's going to be a secure sense of self, and there's going to be identity diffusion. There is also negativism, which we said as the emo phase people go through. There is peer groups and the development of morals. Morality is conformity to shared standards, rights, and duties. What's important here regarding morality is the 3 levels we talked about. Let's just give them names. Pre-conventional morality is the determining factors of pre-conventional morality are punishment and obedience to parents. This is when you're younger. Morality of conventional role conformity is when children conform to gain approval of others. Morality of self-accepted moral principles is when children or adolescents comply with rules on the basis of ethical principles. Their internalized moral compass, so as to say. Adulthood is the longest phase, divided into early from 20 to 40, middle from 45 to 65, and then late or old age, which is just 65 and onwards. It is all of these things that we talked about: marriage, social roles, adolescent crisis, getting a job, self-sufficiency, the transition, which may be smooth or rough, vulnerability. Good adjustment creates invulnerable adults. Occupation, and some other socioeconomic issues, for example, systemic racism and socioeconomic status, gender. And you guys are going to say, why do I have 6 slides in one? Because I already talked about all of this. The only thing I didn't really talk about is this valence correlates of well-being. Valent is this scientist. He coined correlates of well-being. He said that there's a strong correlation between physical and emotional well-being, and that people with poor psychological adjustment during college had high incidence of physical illness in their middle ages. Yani if you're doing bad now psychologically, you might have higher incidence of physical illness when you're middle-aged. So take care of yourselves. General stability at home accounts for a well-adjusted adult. Close sibling relationships during college years accounts for well-being in middle-aged, and the middle age. And we talked about all of this. But still, pause and read. Late adulthood, we talked about all of this. There's young old, which is from 65 to 74, and then old, which is from 75 and beyond. And as I said, we have the well old or the sick old, which is, the frail elderly people. We talked about senescence. There's some things that are important in old age. So, for example, we know that women tend to live longer than men. We know that certain races, certain ethnicities, for example, Japanese people, they tend to live longer. Exercise, diet, and health and their effect on growing old. And there's the problem of isolation, ageism. Ageism was coined by Butler, and a mnemonic here would be AB, like the alphabet, ABC. Ageism, Butler. And sexual activity decreases for most. 70% of men are active, 20% of women are active over the age of 60. There's long-term nursing homes, psychiatric problems. We said loss is a predominant theme, and prevalence of major depression because they have to deal with grief. Now, just to touch up on death and bereavement again, we said thanatology is the study of experiences of dying and bereavement, an evolving area. Reactions to death may be experienced as timely or untimely, can be thought of intentional, suicide, unintentional, sub-intentional, like someone that would do heroin or smoke to death, basically. Near-death experiences, they sometimes happen to people where they think they're seeing angels, or they're seeing a dark tunnel, and it causes them to have major lifestyle changes. They become more religious, they start giving to charity, and then the Kubler-Ross stages of impending death, and this is super high yield. And hatta if you're going to have SAQ, يمكن you're going to be asked about this, I don't know. So stage 1, shock and denial, stage 2, anger, stage 3 bargaining, stage 4, depression, stage 5, acceptance, and we talked about all of this. Again, the star means high yield. Attitudes toward death across the life cycle, we talked about this. For pre-operational, it's like sleep. For concrete, inevitable mortality and fear of parents dying. By 9 or 10, they conceptualize that death can happen to anyone. By puberty, BHS formal operation stage, that death is irreversible and is universal. So obviously we know what grief is. Mourning is a process by which we relieve grief. Bereavement is the state of being deprived of someone due to death. Expression of grief includes a wide range of emotion, depending on cultural norms and expectations on circumstances of the loss. There is initially a state of shock, which is short-lived, and followed by expression of suffering such as crying. Things command such as feeling weak, decreased sleep, loss of appetite, dreaming of the deceased, and survival guilt. Survivor guilt is, let's say you're in a car accident with your friend, asmahullah, and you were speeding and you were driving, and you get into the accident, you survive, but your friend dies. You're gonna have survival guilt. Like, why did I live, but my friend died, right? Denial, illusions or hallucinations, identification phenomena, which I explained. All of this falls under normal grief. This is healthy grief so far. Even though it sounds not very healthy, like illusions or hallucination or survivor guilt, it's all normal, healthy grief. When things become psychotic, right, or there's suicidal ideation, this is when we have abnormal grief. And to differentiate between grief and depression has persistent low mood and comes with shame and guilt and suicidal threats. Meanwhile, grief is time limited. And then we have the issue of anticipatory grief, which is when you know someone is going to die. Someone received a terminal diagnosis and you're anticipating their death. And so as the date of their death gets closer, you're either going to feel more grief or less grief. And then there is the grief period, which traditionally lasts from 6 months to 1 year. Acute grief subsides subsides, and within 1 to 2 months, the grieving person can resume function. Now, Bowlby, who we also talked about in the attachment lecture, Bowlby said there are 4 stages for grief. Okay, stage 1 is basically shock. It's acute despair, denial, and it lasts moments to days. Stage 2 is intense longing. It's physical restlessness, and it's going to last months. Stage 3 is the phase of disorganization and despair, insomnia, and weight loss. Stage 4 is the phase of reorganization, and the disease is internalized. And the way I think about this is that stage 1 is the shock, stage 2 is basically depression, stage 3 is helplessness. Yani you give up, you know they're not coming back, so you just stop wanting to eat, you get weight loss, you get insomnia, and then stage 4 is when you're starting to get over it. And this entire thing is super high yield. You should know all of this, and it makes sense, guys. This is easy so far, inshallah yani. And then we have childhood grief. Bowlby, the same guy, said there are 3 things for childhood grief. There is the protest phase, there is the despair phase, and there is the detachment phase. Okay? Parental grief, on the other hand, follows Kabler-Ross, the 5 stages of grief. And sallallahu barak ala nabiyyina Muhammad, this is the entire BHS crash course. Again, as I said, guys, go through my crash course, go through my slides, focus on what is highlighted in red, and what I said is high yield. That's if you want to pass. If you really want an A+, again, do my crash course. It's still good. And do the transcriptions after, and also do practice questions. This is the feedback form. Please scan it. Let me know if I can do a better job next time. And this is my contact information. Guys, don't send me emails. I'm not going to check my email. Just text me on WhatsApp. And please let me know if you guys have any questions. Best of luck. وبالتوفيق جميعا.